Hi, everyone. Good evening. Good evening. Good evening. Yeah, you're welcome to the Norse Mentorship Academy, the graduation ceremony of the Cohort 2 of the Next Mentorship Academy. So I'm going to bring over here the moderator of this event. We're not going to take much of a time because we have loads of things lined up. Please, if you can hear me, can you just let me know in the chat box that you can hear me? So, Biloba, can you hear me?
Oh yeah, I can hear you, ma'am.
Okay. So we want to come live on the video and so we can start. So we're just going to check all the networks. We're supposed to be live on YouTube, LinkedIn, and on Facebook. So just do the last technical checks to be sure everyone is covered. Lots will be over to you, please.
Thank you. Please. Okay, are we sure people can see us from the different platforms now?
Yes, I have five people viewing. Five people viewing. Three from YouTube, three from Facebook. Six now.
Oh,
And it's live on
awesome.
LinkedIn as well. I can't find your video anyway.
I'll join in now.
So we just give few minutes to arrival of candidates, speakers, just for you to be settled as well wherever you are watching this from. It's the Norse Mentorship Academy, an initiative under the Norse Coach Ola Health and Career Consulting. My name is Ola Karemu. It's a pleasure to have you all. It's a pleasure to be here myself. It's an honor. It's a privilege, to be able to serve in this capacity. Welcome, everyone. So, tighten your seatbelt, okay? Just relax. It's going to be a very interesting journey. This evening, get a cup of tea, get something to snack on, you know, just get something to relax. Yeah, we welcome the participants everywhere. Please join in here. We know that we only have at the moment you might, for those that are watching us on Facebook, if you're watching on LinkedIn or directly on YouTube at the moment or probably later in the future. So we have our guests in the house, we have the graduates in the house, and some of them will be joining in soon, and their family, friends, watching live just as you are. So thank you so much for joining. Over to you, Oluwatobi.
Thank you so much. Thank you, Nurse Coach La. I'm so glad to be here this evening. Once again, good evening, everyone. Good morning, good afternoon, good evening, from any part of the world you're connecting from. We are up for a great show this evening, and I believe we're all going to enjoy ourselves. Going to learn, relearn, unlearn, and have a good time together here. So I want to welcome us all once again. Yeah, hi Adams. I can say good evening, good morning, good
Hi,
afternoon.
Adam.
Good evening.
Adams, what's the time of the day in your area over there? Is it morning, afternoon, or evening?
Yeah, it's afternoon. It's 5 p.m. in the afternoon. So I'm in
Same time.
I'm in the UK right now, but I've just come back from Lagos.
Oh, great, great, great.
Good.
Yeah, that's good to know. You're welcome on the show. We're so pleased and glad to have you this evening. Yeah,
Thanks.
and everyone, just stay with us. We'll kickstart the program. So let's just await the arrival of some of our participants, and we'll dive in right away. Thank you.
So again, if you're joining, I'm just going to be deputizing the moderation with. I know Luatomi is the moderator, but don't mind me. I like to jump, so I'm going to be coming in once in a while. So if you're watching us wherever you are, you can just let us know where you're joining in from. If you're a friend, if one of the graduates, your family, you can just say, "I'm here. I'm invited by Oluwatobi. I'm invited by Akpan." Just let us know in the comment sections where you're joining from. If you're, just if you're invited, who invited you, or if you're just a lover, just let us know. All right. Thank you. So we just let me know when we are going to the.
Okay, great. Yeah, I will do that.
I
Right.
think we can just go
Yeah,
ahead.
we can go ahead. All right. Once again, I think I need to see the chat here. Not Coachella, please. Can you send me the YouTube link or something? Yeah, I can follow the chat.
Yeah, I can see the chat. I can do that. See so that you can concentrate on the moderation.
All right.
And Bankole, can you see the charts? You should be able to see the chart on the screen here, right in the stream here. So, okay. Bankole Oluwaseun is joining there from the YouTube, watching from YouTube. Babayo Milawara from LinkedIn. Sharadon Davis from LinkedIn. Fian Ikena from LinkedIn. At the moment, we have 7 watchers, live watchers. And yeah, Kate is one of the graduates this evening. Hi, Kate. Hi, Kate. Come in, stay true. You must stay all true. You're welcome. So I think we can go ahead to the next, right?
All right, all right. Yeah, thank you so much, Nos Kuchala. Oluwapelu Emmanuel, I can see you in the house. Apan, you're welcome, you're welcome, you're welcome. Okay, I think I can see the live chat from YouTube now,
Yeah.
and I can see that we have 7 participants at the moment, and we are expecting more people to join in, right? Yeah.
And
Welcome on.
Roderick.
Yeah.
Roderick is joining from the Republic of Ireland.
Wow,
Hi.
awesome. Awesome, you're welcome. All right, right away, guys. Without further ado, we'll just move on to the next agenda on the program while we await and allow others to join. If you are here and your friend is not here, your family members, your friends, your colleagues, or just send them a reminder. The Norse Mentorship Academy graduation ceremony for Cohort to has kickstarted. So just send a reminder to them, to join us in this session. So right away, I will be inviting the director of Norse Mentorship Academy, the person of Norse coach Ola. Sorry, that's what I call her. That's not a full name, but that's what we know her with, right? That is the person of Olayinka Aremu. So welcome everyone, and give us a short introduction to what we are here to do this evening, and about the Norse Mentorship Academy. You are welcome, Norse Coach Ola. Thank you so much.
Thank you. Thank you so much. Just let me. Okay. Hi, everyone. Hello. So it's a pleasure. It's really an honor. It's a privilege to be here. I'm so excited. I see how I can best way to stream this for myself. Okay, so good evening, everyone. My name is Olayinka, just as I've been introduced. My full name is Olayinka Aremu, but I'm called Noskoshola. That's no, just call me Noskoshola. Over here in Ireland, sometimes it's really hard for them to pronounce your full name, and they just kind of mess up with the name. So I just give them Ola. So you can call me Ola Noskoshola. You're welcome. So, this is Norse Mentorship Academy. You're welcome. It's a great privilege to be here, to be the executive director, and to be the founder of of this great initiative. And just for those that don't know, so Norse Mentorship Academy is one of the initiatives of the NCO Healthcare Consulting Limited, of which I am the founder. So a couple of other programs like that. But the Nurse Mentorship Academy particularly is, focused on young nurses and aspiring healthcare professionals. So that's what we do. How did this all start? So I say this Nurse Mentorship Academy was actually birthed from my 11 years. I can't believe it's 11 years already. 11 years of, mentoring unofficially initially, and later on we had to convert it to an official mentorship program as the numbers increased. So I was very out of 11 years of experience. I've worked in different areas of nursing, particularly in the education section. At the moment, I'm the clinical nurse manager, two in capacity of patient flow manager in the health service executive in Ireland here. So I work as a geriatric nurse, discharge nurse, coordinator, and all that. But I'm particularly, interested in the growth of all nurses, young nurses, and by extension, all healthcare professionals. Because as the program increased in number, we had to extend it to other healthcare professionals. All right. So to say, the nurse, I'm just going to add to my screen here again. All right. So talking about the Nurse Mentorship Academy, we provide the guidance, inspiration, support, and tutoring skills. If you're a graduate here, if you are a G-Star, you know what it means. So the acronym for what we stand for, the core values of the NMA is GIST, GIST. And the G there is for guidance, inspiration, support, and tutoring. So that's what we do, to inspire young nurses and aspiring professionals to be the best version of themselves, in helping them to have a rewarding healthcare career. We know that, over time, especially with the COVID, there have been a lot of burnouts, frustration, and all that on the part of the nurses and healthcare professionals. So you need something else that can be your drive. So the Nurse Mentorship Academy is available, is that platform. So it's a 6-month program. Initially, we started with 90 days, but because of the demand, and we are expanding, of course. So the next phase of this will be going into 6 months, including monthly modules, customized mentorship, accountability partner, and coaching like that. And some of these are done via Zoom as well. And the vision of the academy, like I said, is to enable and empower healthcare professionals to be the best version of themselves, to be high performance healthcare professionals. We'll talk more about this later. And the mission I've mentioned is to provide what I call the GIST, the guidance, inspiration, support, and tutoring that all healthcare professionals need to have a rewarding career. So who is this for? I think I'm repeating myself now. It's young nurses and aspiring nurses who are looking for guidance and support in the quest of their professional, personal, and interpersonal growth. This it's one very key thing when it comes to the Nurse Mentorship Academy. So our courses, we have core courses and we have elective courses. And by virtue of this graduation, we have another, elective courses coming in. The core modules ranges from the journey of self-discovery, because you need to discover yourself, goals and goal setting, the art of public speaking, talking about personal and professional development, developing the leadership and mentoring skills. And we also have a beautiful one, nursing and entrepreneurship, or what's by extension, it's entrepreneurship. Okay, and the elective course modules, you can select out of these and you can have all of them. Evidence-based practice in nursing research, career transitioning for new nurses, talking about healthcare communications. We have a module for international pathways for Ireland, UK, where you want to transit to as an healthcare professional. We have another one called talking about cross-cultural adaptation, dealing with culture shock, and a whole lot. So how this program is designed, like I said, is 6 months, and you have opportunity to have a monthly module and one-on-one clarity call with myself or your allocated mentor. And we also have group mentorship as well via Zoom and the Telegram group for support and all that. So that is how you learn. Certificate to be issued, and they will be having their certificates, after this graduation. We'll have them. And by virtue of the academy as well, we have an ebook, paperback. The book Emerge is launching For those that have, booked this book, pre-ordered, you must have gotten a notice of, notification of the book being released. This will be launched very soon, hopefully. And all graduates from this academy has opportunity to belong to the NMA Legacy Network, where they can also, begin to grow their own mentorship tree as well. They can become a mentor, be trained in this pathway as well. And they have opportunity to volunteer with the Respo Health Africa or other international global opportunities. And now talking about the Emerge book. So that is the copy of the book that was birthed, I say, from the academy. So this is kind of like the synopsis in form of storytelling and, experiences all put together in the book. The title is Emerge as a Health Pro. So if you look at the dictionary, this word Health Pro is not available, but I've been able to bring this together because this is a concept that I actually want to pass across. A health pro is that healthcare professional who has been equipped with the extracurricular skills and capacity added to the innate knowledge of their profession and practice experiences. And this will help them to match this up with the global healthcare demand and economic development. So I say that a health pro is a high performance healthcare professional. So if you are graduating from the Norse Mentorship Academy, congratulations, you are on your way to becoming a high performance healthcare professional. So this is just a new module. Like I said, this is called the high performance model that has just been created to help incoming, even everyone in the academy. And it has 6 cores: leadership in the global health, community health partnership, international policies and governance, rural health, technology, telemedicine, and investment finance. And by virtue of these 6 cores, we have different guests that will be, speaking with us today. And, later on as well, we'll be having more discussion on these models. So we've had a lot of feedback over the last 2 cohorts. I just picked this one out because it kind of summarizes, everything in a way. So the academy has aided me to have more clarity on my goals now. I was able to, I'm trying to see that, I was able to meet with my mentor to draft out short-term goal. So this is something that we do as well from the one-on-one clarity call, to be able to identify what are your long-term goals, what are your short-term goals, how do you make your goal realistic, how can you make your goal work. So thankfully we got this feedback and meet our team. We are growing, and I know in the coming few months now we'll have more people join. And so I really want to appreciate every member of the team, everyone. Thank you so much. Kafila is from the US, Bethel is in the UK, Sharon is in Nigeria, Oluwatobi, and Mohammed is from Sierra Leone. So we are not just Nigerian based, we are global. So thank you so much for working with me. So from moving on, after these cohorts, because of the demand and trying to meet the request and specific requirements of our mentees, we are introducing the Emerge Mentoring e-learning portal. So we've had a lot of challenges with Zoom meetings, network failure, not being able to, clarity of audio and all that. So the learning portal, it's designed to meet this need. So congratulations to the incoming cohorts or as many that will join the mentorship, and the portal will be open from September. So early bird registration is available if you want to avail of that opportunity, and the portal will be laptop and mobile friendly. So you can contact us via email. You can check our website, ncohealthcareconsulting.com, for more information. Thank you very much. It's an honor to be here, Oluwatobi. Thank you. Thank you, everyone.
I'm muted. Okay, thank you so much, Nurse Kochola, for that very detailed and very expository introduction about what Norse Mentorship Academy is about. Thank you so much for that. I mean, guys, if you are in Norse Mentorship Academy, just come to Norse Mentorship Academy for 1 month. After 1 month, I can guarantee you that your thinking, your perception, I mean, your mindset, and a lot of things are going to change about you. It's been an awesome time in Norse Mentorship Academy. Yeah, thank you so much. Right about now, we're going to be moving on very fast to the presentation of the mentees. Yeah, we are the first cohort, and now the second cohort is graduating. And also, to do this, I'm also going to be inviting the executive director, Nurse Coach Ola, to present the, I will call them graduates now, right? The cohort to graduates, right? Yeah, thank you so much. You're welcome on stage, Ma.
Okay. Thank you. I'm trying to get which of the videos. Just 1 second. And while I'm waiting for preparing for that, I want to welcome our guests. They are here already. Some of them are joining live. Obina Victor is here. You're welcome, sir. Thank you so much for doing us the honor. I can see Dr. Yewande joining from YouTube. Dr. Yewande, if you can hear me, can you please come via the StreamYard link, please? Dr. Yewande, okay. If you can join us via the StreamYard, that would be appreciated. Thank you. Can we just get to know other people joining while I'm trying to sort this out? Thank you very much.
Okay. So let's proceed with that there. All right. While we wait for the introduction of the mentee, I would like to say I would like to welcome Nurse Victor Eze Obina. Hello, sir. Good evening, good morning, good afternoon. Thank you so much for joining us. So glad to have you here again. I'm so fired up for I mean your session tonight, and it's going to be a great one. Glad to have you once again. Dr. Yewan, you can hear us from YouTube. Please make use of the StreamYard link and join us at this end. Thank you so much, Ma. Okay.
Okay, so
All right. Thank you.
can you see my screen?
Yes.
Okay, I'm just trying to play the video. Okay, sorry, this is technical issues. Okay, I'm going to get it right. 18. One. Okay, so presenting to you the graduating mentees. Let's give everyone a applause as the people. Those are the cohort 2 mentees of the Norse Mentorship Academy. If you see yourself, let us know if you see yourself. If you see your friend, just hide their name, hide their name. Thank you, thank you. I hope everyone was shown. I'm sorry if your picture is not there, but you're all recognized. Thank you so much.
Right. Thank you so much, Nurse Coach Ola, For to every mentees, I want to personally congratulate you for coming thus far. I believe you've all enjoyed yourself while at Norse Mentorship Academy. Okay, before I move on to the next session, I'd like to. I'll be happy to announce to you that uh, I am an alumnus of the Norse Mentorship Academy. I mean, the very first cohort one of Norse Mentorship Academy, and I can tell you for free that it was an awesome session, awesome time over there, right? Thank you so much, and I congratulate you once again for being part of this wonderful program, right? Okay. Right about now, we'll move on to the next thing we have on our agenda, which is the peer presentation. The peer presentation.
Okay, so I think who do we have first? Deborah.
Okay, Deborah, if you're in the house, can you please unmute
Okay.
yourself for your presentation? Yeah, you're welcome. Hi, good
All right. Good
evening.
evening.
Afternoon.
Okay. Can you hear me? Can everyone hear me?
Very well, clearly.
All right. Okay. All right. Good evening, everyone. So briefly, I will be presenting topic that says harassment in the healthcare setting. Harassment in the healthcare setting. So briefly, I want to talk about in the recent times we've been hearing a lot of things happening in so many healthcare settings about how nurses are being harassed, and you know we really want to talk about this thing today. What is harassment? At what point can we say that this is harassment? Because so many times we talk about harassment, but if that then we are discussing amongst our friends, but when it comes to official discussion, people try to sweep it under the healthcare setting. There's not going to talk about harassment in the healthcare setting and how do we report it.
Okay, I think we are listening. Deborah, the network isn't friendly there. This is one of the reasons why we are going e-mentoring. Hi, Deborah.
Oh, I think we just lost audio to some maybe network
Yeah.
instability from our hand. Okay, are you back, Deborah? Can you please unmute yourself? Your mic is muted. Can you unmute yourself?
All right, okay. At what point did you? Sorry, should I go over what I said again?
Yes.
Yes, please.
Yeah.
All
Your
right,
video,
okay.
please.
All right, okay, sorry. So I said briefly today I'll be talking about harassment in the healthcare setting. And recently we've been hearing a lot of things happening in different in so many healthcare settings about how nurses have been harassed. So we want to quickly address, we want to quickly look at this topic that says harassment in the healthcare setting. And like I said earlier, I said harassment is any form of unlawful discrimination that includes things like using abusive languages, making jokes, silly jokes, behavior that demeans, that embarrasses or humiliates anyone, or a behavior that you try to anoint someone on purpose, you try to alarm someone, you try to gaslight someone into acting in a way that ordinarily this person would not behave. WHO identified disrespectful behavior as a silent epidemic in the healthcare setting. And it is estimated that about 50% of employees globally experience disrespectful behavior in the workplace. So, this behavior includes words,
Okay. Think we just lost her again.
oh wow, hello, I'm
Yeah, the
here.
network is not friendly.
Oh, sorry.
Okay, go
Sorry
ahead.
about that.
Go ahead.
All right. All right. Okay. Thank you. So, we want to talk about types of harassment. We have the verbal harassment, we have the psychological harassment, we have the cyberbullying, we have the sexual harassment. So let's talk about verbal harassment. What's verbal harassment? So verbal harassment consists of using demeaning slurs, you're using abusive language or offensive gesture, unwarranted criticism. You just want to, somebody does something to you, instead of to say thank you, you cannot appreciate the person. You keep criticizing the person. The person keeps feeling less of himself, and in the long run, it affects.
Okay, I think we can skip because just for the audience to really catch up, um, we might have to skip this, Deborah.
Productivity. The person would not deliver the way he or she is meant to deliver. So have forms of harassment, and victims of verbal harassment often also. Oh, hello,
Yeah, Deborah, I think we
hello.
might have
Can
to,
you still hear me?
we might have to take this later on, okay? Because
Okay.
the network isn't fine. We want everyone to enjoy. We know you have beautiful, you're well packed. We can take this at another time. Is that okay?
All right. Okay. Okay, ma'am. All right.
Thank you.
All right.
I think we would skip the peer presentations for this purpose. And just
All
for
right.
our audience to be aware, this was one of the requirements for graduation for all our mentees, that they needed to do their peer presentation. We just selected 2 out of these presentations, for the viewing pleasure of our audience today. But because of our time, and we want to keep the time actually, and we want you to also gain from it, we're going to put this peer presentation into a recording and shared with you later on. Thank you very much.
All right, ma'am.
Right. Thank you so much, Deborah. All right. Like Norse Coach have said, we'll be skipping the part, and it should be sent across to every other one to listen some other times. Right about now, we'll be moving on to the goodwill message. Goodwill message. I mean, we have our guest and the hours to give our mentee the goodwill message, and we'll be starting with. Okay, let me confirm that. No,
We
Coachella,
can
can you
we can
please?
take Adams first. We can take Adams since he's been here. Adam
All
Thompson.
right, all right. So we'll be calling on Adam Thompson to give his goodwill message right about now. Mr. Adams, good evening once again. We're glad to have you on the show.
Great, and thanks, Nurse Bula and the whole team for inviting me and for having me. It's my pleasure and my privilege. I wanted to first off congratulate the graduates, those nurses and healthcare professionals that have dedicated the last dedicated their time and their energy to seeking out mentorship. I think mentorship and in the healthcare sector is both necessary but also potentially transformational. If you haven't, there's some very great inspiring medical professionals that talk about the changes in their career and the lives they save and how much they dedicate that to the mentorship they received and being able to seek that out. It's not always.
Adams, can I just interrupt you a bit, if you don't mind? I know this is we want to. I have one of the mentees here that has been committed.
Sure.
Actually fetched out a citation for you, and she's going to read out your citation if you don't mind. Before
Absolutely.
we go ahead with that. Is that okay?
That's perfect.
Latobi, who is taking the citation for Adams?
Pelumi is doing that, right? I think.
Okay, so I'm just going to add Pelumi here. Pelumi is one of the enemy alumni, the first cohort, and she will be taking the citation for Adams. Thank you, Pelumi. Can you hear me?
Yeah, good afternoon, everyone. Can you hear me?
Yes.
Yes, clearly.
Good afternoon,
Go ahead, please.
Mr. Adam. So I'll bring your citation now. Thompson was a technology instructor for Senior Academy from January 23 to January 2025. He worked with collaboration with non-governmental and non-profit agency on developing and carrying out after-school programs, and that was in Wellington. For more than a year, we worked with faculties on instruction side to add functionality and accessibility and to streaming audio and video and simple web-styled, fully standard compliant site as a web developer. It, he also worked as a trainer, coordinator, and curriculum developer, community organizing tech camp from August 2006 to 2009 to plan and develop training to more than 100 community organizers from all over the United States. He was the associate director for programs and instruction for global information internship programs for more than 7.
Okay.
Hi, Pelumi, are you still there?
So this one thing about this
Hear me?
audio. Okay.
Hello, can you still
Yes, go ahead,
Yes,
Pelumi.
yes,
hear me? Can you still hear me?
Yes.
yes. Pelumi.
Okay. Should I start all over?
No,
No.
just continue from where you.
Oh, okay. So he's the Chief Executive Officer for EHA Clinic, which is a social enterprise that delivers high quality health care through a network of the state of art facilities and community health workers. He is the president of EHA Impact Venture. He is also the executive director at the EHEalth Africa, and that has been for more than 12 years. He's a member of the board of directors at EHEalth for Africa, Washington, the District of Columbia, and United States. Help me welcome Mr. Adam Thompson once again.
Wow.
You're welcome, Mr. Lance.
Great, and thanks so much for that. And just to start again, yes, my name is Adam Thompson. I'm currently serving as the CEO of EHA Clinics, and we're a healthcare. Our basis is in primary care, but we provide a lot of services across the whole healthcare spectrum, and we're trying to focus on building a very high quality, accessible and affordable healthcare network in Nigeria. As I was saying before, again, I think seeking out and participating in coaching is such a key activity in order to really further both yourself and your career. There's a very famous doctor and public health professional doctor in the US, goes by the name of Atul Gawande, and he wrote a whole series of texts on coaching and about how coaching was the key to both instilling positive habits of thinking, breaking our actions down, and then helping us build them back up again. And he said that it's not about how good you are now, it's about how good you're going to be that really matters. And that in order to be a leader, that you really have to be intentional about who you seek and accept feedback from. You've really got to embrace both gratitude and discomfort, because being coached and being open to coaching can be very uncomfortable when you have people telling you and breaking down your actions and decisions and helping you think through them in a critical external lens. That can be very uncomfortable, but it's the way that we grow and it's the way that we improve. I just give a couple words around EHA clinics and what we're doing around the future and why I think both this Mentorship Academy in terms of looking to be and to build your skills and to build yourselves up, as well as the fact that this is done online, this is done utilizing technology. We're moving into a space now where nursing when it doesn't necessarily have to happen, and the type of care that's provided by healthcare professionals doesn't have to happen in a facility. There's plenty of avenues, and in fact, there's these great initiatives that are happening that are allowing people to access healthcare advice, healthcare management, whether that be in the, like, for example, I spoke on WhatsApp today to a nurse in Cape Town who's managing the discharge and the transition to home for my 96-year-old grandmother. And to me, it's just so fascinating to be able to manage that discussion online. I'm thousands of miles away, and being able to work with someone in a different country, and organize care from someone, and also get feedback in terms of what needs to happen. My grandmother happens to be pretty particular and doesn't like to take advice from a lot of people. So the fact that I can speak with the nurse, really get the plan down, and communicate it back to my grandmother means that we can really work out a plan that helps take care of her. And I think what it does is also drives accessibility. The reality is a lot of people struggle finding advice on what to do when someone's sick, what to do when they're not feeling well, what to do when they're having anxiety and having these and depression and sleeplessness, and getting access to healthcare professionals used to be still is in a lot of parts of the world a difficult endeavor, requires often a significant amount of money, requires a lot of discomfort in terms of going to a facility, waiting at a facility, and going up the whole chain. Where it's nowadays, for example, at our clinics, we're able to pair people that need healthcare that interact with us online. For example, one of the areas around mental health, around anxiety and depression, sleeplessness, it used to be that the only way that you would get help for mental health conditions is you go to a hospital, you find a psychiatrist, and then you go through that whole process. Whereas now there's these amazing digital tools that help other health professionals, like nurses, like social workers, like community health workers, access a body of knowledge around mental health, access plans and tools to help people with anxiety, and then they can help drive it themselves. So you can be taking care of someone, and then you have these digital tools, you have these amazing resources at your disposal, so you can provide your skill sets not only just where you are and what physical building you're in, but to many people around the world in different areas that can't access you, that wouldn't be able to access you otherwise. So I really encourage you to really think about how you make yourself accessible to people in need, to potential clients, to potential patients, family members, friends, and think about utilizing these emerging tools, these emerging technologies to do that and to make that transformation. Let's not get stuck in the past. Let's not get stuck in the way that we ran hospitals in the 1920s and 1930s. We're ready for something new, and we're ready for that transformation. And I think you all taking the step to join the Nurse Mentorship Academy and really think about how you're growing yourself personally, how you're growing yourself professionally, and I really encourage you to think about helping and joining and doing the work to really transform the health sector to make it more accessible to those in need. And thank you very much for having me.
Okay.
Thank you so much. Thank you so much, Mr. Adams. That was a wonderful one. Really, thank you so much. I think Nurse Kuchela wants to say something. Yeah.
Yeah, I have to say something when it comes to Adams, to be honest. For this invitation, I'm privileged, I'm honored. Adams, thank you so much for honoring. It was impromptu, and for those that know already, what Adam was telling us, he's giving a good message, particularly. But I've asked him to talk to the mentees and everyone about the importance of remote health and the use of technology. So we've all had the citation. We know everything Adam does, especially with his keen interest in Nigeria. and Africa as a whole. So, and it's really remarkable what you're doing. So thank you so much, Adams. For those that don't know, you can go and check EHA Clinic, EHA Africa on LinkedIn for more details about, the works of Adams. Thank you so much for having us. Thank you.
All right, thank you
Bye.
so much.
Thank you all.
Thank you, Adams. Please do enjoy the rest of the day. All right. Okay, so right about now, we'll just move on right to the next, our next guest in the house. Okay, to everybody watching us from Nigeria, from the United States of America, from United Kingdom, from Ireland, anywhere you're watching from, this is Norse Mentorship Academy, and this is the graduation ceremony for the cohort to of the academy. Now, right, we are still in the goodwill message session. Okay, now we're moving on to the guest presentation. We'll come back to the goodwill message. So one of our guests, a very big person that I'm not even worthy to introduce. I think I'll have to pass this introduction to someone higher than me here. But before I do that, we are moving on to the guest presentation, and we have one of our the fathers of modern nursing in the house. We know the mother of nursing to be Florence Nightingale. That was some 19th, 18th century back. But now we have the 21st century father of modern nursing right here in our midst, and that's a person of Victor Eze. Is a global nurse leader. I mean, we're going to read the citation shortly, and you would see what I'm talking about, right? If you are excited to have, even without listening to the citation yet, if you are excited to have Nurse Victor in the house, can you just jam your hands together anywhere you are? Nurse Victor, we're so glad to have you. You're welcome. Good evening.
We'll have Deborah to read the citation.
Right.
Yeah.
Okay. Good evening, everyone.
Yeah, good
Can we
evening.
have Nurse Victor, your video on and behavior indulgence? Yeah, thank you so much. Okay, go ahead, Deborah.
Good evening, everyone.
Yeah, good evening, Deborah.
All right, okay. Mr. Victor Eze Obina is the founder of the 360-degree Health Network, a former lecturer, a Commonwealth Scholar 2021, and a Mandela Washington Fellow for 2021, the Young World Ambassador from 2019, a global health advocate, and a Nigerian and UK registered nurse. He has featured as a speaker on the
Okay, I
same
think
stage with high-ranking personalities such as Megan,
right.
like the Duchess of Sussex, Richard Branson, and a host of others. He has also networked with the former President of England and the United Nations High Commissioner Society, and is very much, Mr. Victor.
Thank you. Don't worry for everyone. Every statement that was missed, that we're going to publish the citation for our audience to, to have a full feel of what our guest is all about. Thank you so much, Mr. Obina. Let's give him a round of applause. Thank you so much. You're welcome.
Thank you. So, this is my section, right?
Yes, please.
Okay, thank you very much. I so much appreciate. Now, it's not every day we have platforms like this where young mentees are being graduated to go and implement all they've learned over a period of time. Now, I would always tell young nurses in Nigeria and other part of Africa that why growing up in the nursing profession that I wasn't too opportune to have a role model or a mentor in the nursing space to scale me up. Not that they weren't mentors, but I didn't see any who was actually working on what I was interested in. So don't get me wrong when I said I didn't see any mentor to take me through. So I was interested in a space that was actually different from what so many persons were doing then. So it's good. We now have mentors in nursing way back in Nigeria, outside Nigeria, that you can actually contact or connect with to help you scale through. Just like we have the Norse Mentorship Academy. One thing mentorship does for you is that it reduces the effort you put in towards your own personal growth. All right. So this program is something we should all take very good cognizance of. If you've not registered for this program, this is like a wake-up call to you to put in efforts to start up in the next cohort. If you're one of the graduating mentees, congratulations. I'm looking forward to what you would become and the productivity you would put in and outside the profession. Now, without taking much of our time, I will just go ahead and talk about positioning for leadership when it comes to the global health industry. Now, Norse is growing their platform to become stakeholders in the global health industry through global health. It's something every nurse, both in Nigeria, other part of Africa, and diaspora, should be so much interested about. Now, in this session, I would highlight the meaning of global health. I don't know, Nurse Coach Ola, do you have my slide?
Yeah, I'm working on that. Yeah.
Okay, yeah. So in this session, I would highlight the meaning of global health and relevance in nursing and the global economy. I would also provide guidelines on how nurses can make a difference in the challenging complexity of nursing roles around the globe through effective leadership. I would also talk about how we can embrace and promote inclusion in the global health space. Then I would welcome few questions. Now let's go to slide 4. Slide
Okay.
4, please. Now, positioning for leadership in the global health industry. Now, practicing global health in nursing starts with understanding the subject and how to effectively become a health leader. You're not just a nurse, you're not just one other carer, you are actually a health leader, irrespective of the position you find yourself in your own agency or in the hospital or any space you work in. The global health industry represents the sum total of activities that promote industrial health production, labor markets, financial markets, and resource allocation within a country's health space and between different countries. Now, you would understand that with the increase in the migration of nurses into different countries, the governments of different countries, there are certain targets on recruitment, such as in the UK, sometime in 2019, if I'm not mistaken, they targeted getting over 50,000 more nurses from overseas for the NHS by 2024. And from the recent prediction, it is, however, obvious that they may not really, they will meet these targets, but they would actually need more nurses by 2024. So nurses are part of the key professionals contributing to the growth of most countries. Nurses are the largest professional groups globally. However, nurses, especially in low and middle income countries like Nigeria, are not yet developing and implementing on focused models to measure the nursing impact, including how nursing contributes to the economy, which is why we are here talking about you positioning yourself as a leader in the global health industry. Next slide, please. Now, global health industry contributing to the global economy. How does the global health contribute to global economy, and how does nurses play a major role in this space? Now, we should know that health outcomes affect the economy of nations, and the matters of socio-economic status and population health issues are of major interest and challenge for governments and policymakers. When you look at most economies, you see them focusing more on health because it forms an important part of policymaking. Healthcare access impacts almost every human indicator. Now, think about your country now. Everything that enhances survival in your country, we have maternal and child health mortality rates, we have rates of preventable and infectious diseases, rates of communicable diseases, employability. It takes a healthy nation to have good employees and to have good employers too. We have gender equality. It's also something that relates to health, workforce productivity, trends in mortality rates, and more. The governments of most nations, however, know that without optimum health, that the health of that nation and each productivity level would be something that will not have an increase. So, what are the roles of nurses in influencing these global health indicators? When I talk of global health indicators, I'm talking of these things I've mentioned: maternity and child mortality rates, rates of preventable diseases, non-communicable diseases, employability, gender equality, workforce productivity. These are the things that makes up the economy of a nation. And now we are talking about the impact of the global health industry in this economy. Now, I want you to listen on the roles of nurses in influencing these global health indicators. Now, this is where your positioning as a leader in the global health industry will come to play. All right, next slide, please. Embracing and promoting inclusion of nurses in the global health industry is your responsibility to actually embrace leadership for inclusion in the global health space through the knowledge that I will share with you here. Now, the Norse Mentorship Academy must have provided you with a stepping stone, a foundation to launch out. Now, my section here is giving you that idea that you're not just another nurse who is launching out, who is being developed in the space of the nursing profession. You are a leader in the healthcare space. And I'm not just looking at nursing now, I'm looking at the global health space. So, where am I? Sorry. Okay, embracing inclusion in the global health space. So, what are the things you need to do through the knowledge that you've acquired so far? One thing you should know is that global health drives global economies, just like I mentioned earlier. The role and function of nurses and nursing is linked to each and every one of the indicators I listed earlier: mortality rates, employability rates, workforce productivity. Nurses play a major role because it takes a healthy nation to be a wealthy nation when we talk about global economy. So nurses have significant capacity to positively impact health outcomes in every nation. That is the mindset you should start with while you are launching out as a mentee of the Norse Mentorship Academy. Another thing you should understand is that human resources, the government invests billions of finances and human resources into the health space. Now, increasingly, governments are looking to nurses' workforce as a means by which they will meet the increasing levels of health demand and provide more health care to its population. Now, one thing you should understand is WHO, for instance, will launch a program. They will look for people who work in community settings, most especially doctors, nurses, and other community healthcare workers, because they know they cannot move from wherever their headquarters is in Geneva or anywhere their headquarters is. They cannot move down to this local community, let me say in Uganda, in Zimbabwe, in Mozambique, to implement on these policies to drive the health sector in that nation. So they will need nurses to lead those initiatives, which is why you have to position yourself as a leader in the healthcare space. Another thing we should understand is that governments are looking at nursing workforce to grow its health economy. I mentioned earlier that without a good health economy, there would be no national economy. No nation will develop without its health economy. If you doubt me, look at the implication of COVID last 2 years, what it did to the economy of different nations. It therefore shows that without better health outcomes, without good health outcomes, many nations would find it difficult to progress in their own economy. Next slide, please. Now, nurses have a diverse global health workforce, which is what they should consider as a first step towards stepping up. Now, the question that is important is, how can you grow your platform to become a major stakeholder contributing to the global economy? Now, my topic is you positioning yourself as a leader in the global health industry. Once you've been able to achieve that, you've achieved that positioning in the global health economy. From my narrative so far, you would know that you would go a long way positioning yourself as a leader in global economies. So how can nurses grow their platform to become major stakeholders in global economies? Next slide. Now, nurses can influence and become policymakers. This is very important. Nurses can influence and become policymakers, change agents, and maybe politicians. We can achieve this simply by strengthening our individual efforts towards meeting the UN-defined 13 targets and 28 indicators for SDG 3. Now, the Norse Mentorship Academy, for instance, is a product of the SDG. Even if you're not aware of it, SDG 3 talks about health. One of the SDGs talks about education. Now, this is where the Norse Mentorship Academy comes to play. It is meeting to a sustainable development goal, which is what you as a mentee should target in your workspace. Go back and look at the 17 sustainable development goals. See how you can develop your work to meet any of this need. It can be you focusing on SDG 3, such as my organization, I focus on SDG 3. Then in SDG 3, there are several targets. It might be reproductive health, it might be maternal and child health. You have so many you can focus on. Once you've done this and implemented on it locally, you've started solving specific solutions to problems. All right. So each nurse finding a community need around the goals and providing targeted solutions consistently is the first step to positioning yourself as a leader in the global health industry. Now, WHO designated 2020 as the year of the nurses and midwives to acknowledge the efforts of nurses in global health space. This shows you that nurses serve as important members of the global health space. They are not just meant to occupy the bedside, they are also meant to occupy boardrooms. They are also meant to be community leaders. Nurses are also meant to be research experts and brand ambassadors. So if you're graduating as a mentee from this program and you're limiting yourself that you're just the other nurse who want to count, this is the time for you to stop imagining yourself in that light and start looking at yourself as that community leader who brings about change in his or her community, that board leader in health institutions, that research expert, that brand ambassador, that voice to which other nurses behind you would look up to. Now, about 20 years ago, the concept of global health was not well established, but over the years, global health has been one thing most nations have keyed into in developing their own economy. Global health is an important aspect of public health policy and governance. We cannot separate global health from governance. So global health is very, very important when it comes to governance. Every policy of every government is around healthcare because they know that a healthy nation definitely is a wealthy nation. You can imagine the strength of governance in the UK without mentioning the NHS. If you listen to UK politicians, the NHS is one of the business strategy they are using to boost their political ambition in the UK. Nurses can be positioned as stakeholders in the global health industry. Slide 10, please. So definitely, global health matters to every nurse everywhere. Therefore, in thinking about nursing today and tomorrow, this is very important. In thinking about nursing today and tomorrow, we must all look beyond our backyards. Our backyard is you practicing as a nurse in the hospital. I'm not saying there's anything wrong with practicing as a nurse in the hospital, but you must understand how what happens in distant places, such as Wuhan, China, can affect the health and healthcare of our communities globally. Healthcare is very important. Health outcome in Zimbabwe, health outcomes in Nigeria, health outcomes in China can determine how the economy in the UK, in so many other parts of the world is being influenced because of one fact, migration, which is one thing that drives global economy. So nurses have the professional obligations to understand the world in its broader context. It begins with understanding the policies and the politics of globalization. What is the politics of globalization? We must understand that policies that must affect health are always health policies. We must understand that the global community responds to policies that makes the global community healthy. Once you've understood that, it will help you to develop yourself as a nurse. Now, next slide, please. Now, what are the nursing challenges in providing effective leadership in the global health industry? Now, we've talked about your positioning. We've talked about how you can position yourself. If you've missed anything in the last sections I've been talking about, one thing you should not miss is to position yourself as a leader in the global health industry starts with you solving a community problem. How can you identify a community problem? Go back to the 17 SDGs. Pick up your own target, start working on it locally. While working on it locally, amplify the impact of your work and you will grow from there. So now let's talk about nursing challenges in improving effective leadership in the global health industry. Now, nursing is seriously, I want to stress it, nursing is seriously underrepresented in major global health space. Now, I wouldn't want to be that person who says others are getting it better than we are in the nursing space, but truth be told, others are actually getting it a little bit better than we are because we are underrepresented in major global health space. This has a negative impact on global health as well as nursing practice. Being underrepresented as members of the nursing workforce have a negative impact to the global health space and also the nursing profession. Now, if you're a mentee graduating and so many other persons who will be joining on live, who will be watching the replay, and you are a nurse or you intend joining the nursing workforce, think about strategies on how to increase your representation, your advocacy towards bringing better solutions to the global health space and the profession. Now, the lack of a strong global nursing voice is one manifestation of this, alongside the lack of strong voices from low and middle income countries, indigenous peoples, and young people like us. Now, I mentioned that we are underrepresented, and I mentioned the cause. That the cause is as a result of strong global nursing voice not being available, strictly available, as well as the lack of strong voices from low and middle income countries, indigenous peoples, and young people like us. We need every professional nurse to stand up to this call and increase on our representation. Now, this representation starts from one, the clinical setting, educational institutions, community health agencies, politics, and other aspects of contemporary societies. This is how we can begin to dominate global economies. Now, you've gone from that point where you've realized that as a nurse, you need to function as a community leader, as a change agent, as an ambassador, as a board member of different health institutions. You've grown from that point, right? Now we are in the point where we are saying that we need every professional nurse to stand up to the call and increase our representations in each of these aspects I've mentioned, from the clinical settings to the educational institutions, from the educational institutions to community health agencies. We need effective leadership in these different aspects. We need effective leadership in politics. We need effective leadership in aspects of contemporary society. Contemporary society might just be you being well represented when it comes to the social space. All right. So this is how we can begin to dominate global economies. Why should nurses consider active participation in global health as a means of an end for our professional growth? Now, remember, global health is not another medical field distinct from nursing. Most persons, after their nursing degree, they'll say, okay, I want to go and study global health. But one thing you should understand is that global health is not distinct from nursing. Global health is part of nursing. Global health is part of the global economy. All right. Global health is one of the strategies nations use to remain politically relevant, and is targeted at strengthening various systems when it comes to these nations. So it is very, very much important that nurses play major roles in the global health sector. And how can we do that? Next slide, please. We can do this through strategies such as building our influence. Now, we should know that governance is a means to changing societies through public policy. The health sector is one of the most relevant parts of governance. So if you can grow your influence outside the clinical setting, outside the educational setting, be a community leader, what you're actually doing as a nurse is that you are increasing your influence. Now, look at every nurse who is a role model to you. Look at every nurse who is impacting on his or her society, on the profession. What they've done is that they've gone from that point where they are irrelevant to increasing their influence. Once you increase your influence, listen to the next thing that happens, or the next thing you should focus on is your platform growth. The nursing workforce is a diverse community. All right, several leadership platforms can be strengthened around the profession. Nursing is a very diverse profession. You have people in nursing who can do so many things in the communities that would be recognized in the global health space. that is you growing your platform. Then the next reason why we should consider building our influence, platform growth, is to be visible. Visibility. Nurses are the center of healthcare decision making. Once you hit the hospital, the first set of persons you would meet in their numbers, I mentioned earlier that nurses are the largest healthcare workforce. So visibility is one thing that is important for nursing, not just being visible in a negative aspect, but strategically positioning yourself for leadership to be visible in positive light. All right. So nurses are the center of health decision making and should be more intentional about showing up. Now, the sweet part is, once you've grown your influence, once you've grown your platform, once you are visible, you can create wealth. All right. Global health is a key component that drives the most global economies, as explained earlier. This wealth can also be created beyond the bedside, beyond the clinical setting. It can be created into your pocket. So don't think, okay, because you're positioning yourself for leadership, you're just there solving solutions. You cannot solving problems. You cannot really meet your own immediate needs. No, as a nurse, you should be at that point, or you should position yourself at that place where you can easily create wealth, because your profession has a relevant place in the global economy. Next slide, please. Now, how can nurses build a formidable platform? How can nurses build a formidable platform? The first thing you should do, I've mentioned that you should think of yourself as a board member, a community leader, think of the SDGs, start working locally and all that. But how can you build that formidable platform? It starts by you doing one thing. The thing I did in 2016 with my organization, when I started my organization, 360-degree Health Network, I left the city of Port Harcourt. I went to a village, a community in Delta State, because I said to myself, this organization is something that would impact the health of communities. I cannot impact the health of communities from Port Harcourt. All right. So I had to move closer to the community, which is what I started with the idea of thinking globally and acting locally. Think globally, act locally. Thinking globally is you being aware of the sustainable development goals of the United Nations. Thinking globally is you being aware of the initiatives of World Health Organization. Then you acting locally is meeting the needs of different communities when it comes to the problems you are solving. Now, think globally, act locally was a mantra by a Scottish planner and conservationist, Patrick Gates. Now, the idea of this conservationist is that he said that in climate action, that we should try as much as possible to play our own part in our different environments. So nurses should also get involved in community practice in their own setting, deliver healthcare initiatives in their own setting, and see how to impact or provide solutions that they can step up when it comes to the global health setting. So one thing you should do for yourself is to think globally, act locally. If you think of the WHO, you become more interested in working as a healthcare worker, because the WHO, one thing they do is that, just like I mentioned earlier, if they have disease breakout in Uganda, Guinea, China, what they do is they work with healthcare workers who are there locally. They are trying to provide global solutions. The global solution is, how can we prevent this disease from becoming prevalent in this locality and becoming a breakout to other communities? So they work with healthcare professionals in that locality to see how they would prevent this disease condition from spreading. So provide locally relevant solutions. All right. Now, another thing you need to do is, the second thing you need to do after thinking globally and acting locally, is to define your area of expertise. What are the areas you are so much an expert in? Now, expertise, as we all know, can be gotten through mastery, which is something you do repeatedly. Outside that, you can develop your expertise through what I call gig. Gig, the G there is, you can be a genius, such as, let me say, C. Ronaldo, Messi. These guys are genius when it comes to football. When it comes to writing in the Nigerian space, Wole Soyinka is a genius. So you can be a genius actually in anything you're doing, and through it you can become an expert. But let's say you're not a genius. Let's say you're not that intelligent. You're not like Thomas Edison. How can you still become an expert? You can become an expert through experience. Most times they will say experience is the best teacher. Though I don't believe in that. If you have a bad experience, you become a bad teacher. Okay, so become experienced anyway in the positive direction. Years of experience, results oriented, through trial and error and persistency are one thing that most experts have used to break out. Now, let's say you're not ingenious, let's say you're not experienced, you still have an opportunity to become an expert. And how can you do that? You can do that through educational qualifications. Most nurses back home Africa, we have so many educational route to becoming nurses. Some persons is just your RON, some persons they have the BSc, some persons they have the masters. Don't allow the ideology in your community to limit you from how far you can go. You can get an education in what is it called? Autism. Education of people with autism. You can get just that education, and you will be the next expert that will be called on CNN to talk about people with autism. Because when it comes to this niche, we don't have so many persons going into these niches. They will look for anybody who is available to come represent people with autism and all that. So don't limit yourself. Say, okay, I've studied nursing. The next thing is to go and do. The next thing is, okay, let me just work in the clinical setting with my RON. I don't need a master's. I don't need a BSc. I don't need a PhD. No, be open to learning. Be open to continuous learning. If you have the means, the financial capability, take up more degrees, take up more certifications, take up more licenses. You may not know when you will need it as an expert. Okay, let me quickly go through. I'm almost done.
Yeah.
The next thing for K is be knowledgeable. When it comes to you becoming an expert, you have to have a good wealth of knowledge. Slide 14. The next thing is to seek for opportunities and get involved. When you see an opportunity online, when you see an opportunity, people talking about opportunities, put your best foot forward and apply. Get involved into networking, get into different communities that are progressive, register for the Norse Mentorship Academy. These are networks that would allow you to get involved. All right. So slide 15. Let's go to slide 15. Let me just round up. Now,
Yeah.
lastly, I will talk about the two most critical challenges holding African nurses back from going global, holding African nurses back from being leaders in the global health economy or in the global health industry. The first thing is personal factors such as inferiority complex, low self-esteem, lack of an impact background or work history outside just being another nurse. The next thing is general factors such as their educational background. I've mentioned it. Try to expand on your horizon, learn more, be open to more certifications and all that. The lack of mentorship and guidance, which is what the Norse Mentorship Academy is providing to us today. Now, what are the two most important things they need to do to overcome these challenges? Adapt to the culture of thinking global, get the needed skills, and also look forward to getting mentors and role model in the nursing space. Now, nurses can fit in as role models of many other younger nurses, but our journey is all different. How can you be a role model? How can you be a mentor to other nurses? It's through engaging in programs like this, through developing yourself. I've mentioned about you being an expert. I won't be here today if I'm not providing detailed solutions to problems that people have seen me as an expert in my niche and in the nursing profession. So once you can position yourself, which is the intent of this section, once you can position yourself as a leader in the global health industry, people would start seeking out for you. People will start, then go they rush you. Let me use that local adage. They will be rushing you to become role models. People will be looking up to you as mentors. All right. So I would want us, this is my last call now, to launch out, think of how to provide solutions, detailed solutions. It can be you just providing community service, cleaning an environment. Don't say I'm a nurse, I'm not to go to that aspect. It can be you just cleaning a space. It can be you just helping out in a community service, Rotary Club, and so many other things, Red Cross Society you can do to add to your representation in the community. And at the end of the day, you see yourself growing from there. Now, this slide will be shared to us. Though I don't intend to, but as a last call, this slide will be shared to us because I had to rush through the last section. It will be shared to us. Please, once you get a copy, don't share it outside outside the space of it being given to you, because it's something that I can turn to a book tomorrow it's something that I can turn to an intellectual property. So it is a privilege if you're getting it. Thank you. This is Obina Victor Eze. Until I come your way next time, I will be expecting questions, or we'll move over to the next session. Thank you for listening.
Thank you so much, Mr. Albina. Thank you. Thank you.
Wow, awesome.
I
Thank
expect
you.
a round of applause. I'm clapping. I want to see clap, like round of applause even in the comment section. This is boom. Like boom.
This is a master class, more than a master class. What paying dollars and dollars of, I mean,
Are you sure we are in graduation?
thousands
Are
of
you sure we
dollars.
are in graduation?
I don't understand. Thank you
All
so
right.
much, Victor. Yeah.
Thank you. Thank you so much. Thank you, everyone.
Yeah, I've heard those Victor Eze Obina speak on different platform, and every session is always mind blowing. I've jammed him on Twitter Space, on paid conferences, free webinars. I mean, it's always an eye-opening session, and it's one of the global Norse out there that inspires me a lot. Although I've not
Yeah.
had a personal interaction with him, but every time I have access to anywhere he's speaking, man, I like to just key in and get all those things again. Thank you so much, Victor. We are so glad to have you in Norse Mentorship Academy. Right.
Adeomi, that's one thing that Victor is known for. Is the concept already. Think global.
Global,
Think global, even if you're local. That's it.
Yeah.
So you can act local, but think global, and you can use whatever resources, whatever experience, knowledge that you've gained globally, and apply it, to work in your local area. And something that really interests me about him as well is his interest, passion about the roots, the local. Like 360 degrees came from the local, and he has won millions of grants, 100,000 grants, millions, and all that to support the local community. So thank you so much, Nurse Opina Eze. It's a privilege. And honestly, all these, remember, we're talking about the 6 cores of becoming a high performance healthcare professional. These are what you need. What else do you need? What else do you need to become a high performance healthcare professional? So thank you very much. We'll go to the next topic.
All right. Thank you, Nurse Victor. Thank you, and enjoy the rest of your day. Okay. Right about now, we're going to be moving on to the next session of this program. I hope you are enjoying yourself so far. If you're following us on Facebook, on YouTube, or what other platform, anywhere you're following us from, just show us some excitement in the chat session. Let's know that you're following us. Let's know you're with us. Let's know you're following us. Show us some excitement in the chat box on YouTube. Drop some fire emojis if you've been fired up. Drop some fire emojis, and let's know that you are with us. Okay, I can see a very big person in our midst already. Oh my! This is another mind-blowing session about the come up, right? Okay. I don't know. I just feel so small to introduce these people. I sincerely, but then I think I just have to do this while I would call on Oluwapelu Emmanuel to read the citation. Let's welcome Dr. Yewande. Dr. Yewande, we are so glad to have you in Norse Mentorship Academy. Good morning, good afternoon, good evening from where you're joining us from.
Good afternoon.
All right, good afternoon. We're glad to have you.
Okay, Pelumi, if you will turn off your video, Pelumi, we can have a good audio quality. Thank you.
Can you hear me?
Yes. So if you turn off your video, so we can have a good audio.
Yes, my video is on.
Yeah, turn it off. Turn the video off so we can have good audio. Welcome, Dr. Yewande Okunore Oyekeno. I hope I got that right.
No.
Oh my God.
It's
Sorry,
Dr.
apologies.
Yekeno Oyekeno. I am Yoruba.
Okunore Oyekenu.
Okunore.
Okunore. Okay. All
You
right.
can say it like
Apologies.
the
I'm
way you have
learning.
Okuboye, Okunore Oyekeno.
Okay, Grant. Thank you, Ma. Oluwapelumi, are you happy to go now?
Yes.
Go
Good
ahead,
afternoon.
please.
I'll be
Good afternoon.
reading for Dr. Iwande. She is a volunteer for the Special Monitoring Mission International Human Rights Commission in the United Kingdom. She's the chairperson of the board EA Abland Service Model Project for Disaster Preparedness, which is in United States, United Kingdom, and Nigeria. She's also in charge of a research and development project.
Pelumi, I think we lost you there.
Can you hear me?
Go ahead, please.
Okay. She's a board member at Fremont, California, in United States. She's a member of the Governing Council in UK, US, and the Representative World Humanitarian Organization for Peace and Equity in Lagos, United Kingdom, and United States. She's also an NHS volunteer responder in Royal Voluntary Service. She's a regular member of the Society for Neuroscience. She's also a member of the Board of Advisor for Advisory Cloud in United States. Let me welcome once again Dr. Yewande.
Jam
You're
your heads
welcome, Ma.
together as we make welcome the great King Dr. Yewande. I hope I'm going to get this pronunciation correctly. Dr. Yewande Okunore Oyekenu. Yeah, you're welcome.
Thank you very much for having me today.
Right, thank you, thank you. So we can now have your session now, Mara. Please go ahead. You have a stage.
Okay. I wouldn't want to spend too much time giving a speech because the previous speaker has done justice. However, I would like to have the conversation be in a flow. So I will be focusing on healthcare within the United Kingdom. I am not a nurse, however, I am the product of a nurse. My mom is a retired matron from NMPC Medical Service Corps, and as a nurse, having a child, nurses are the best carers, of course, so it reflects in their children as well. I've met children of other nurses, and when I say my mom is a nurse, and they say, "No wonder you're beautiful." Well, I don't know how true that is, but I must commend nurses. I've been surrounded by nurses, my mom and her friends, most of my life. So I do respect nurses. However, I am not a nurse. I am a healthcare executive. I am a member of the British Pharmacological Society, which I think was not in my intro, and as well as a healthcare executive from the American College of Healthcare Executives. So I do remember last month during the pre-book launch, I invited Olayinka Raymond to join the American College of Healthcare Executives. Why am I saying all these things? If you see that I am from International Human Rights Commission, yes. What is a healthcare worker doing in human rights? A lot. So when you are becoming a nurse or you're graduating as a nurse, you are not going to end up within the hospital premises. You should be out there. That is where decisions are made, and we witnessed this during the COVID-19 pandemic. So I will just give a little bit of history of my experience as a healthcare worker in various categories. So I will start recently, most recently in 2015, the British Pharmacological Society annual meeting in London, we found out that paracetamol was the most abused drug. And abuse is not just happening in the homes, but it's happening in the pharmacies, happening in the hospitals. Drugs are abused daily by we healthcare workers. How? Because paracetamol is not a prescription drug, meaning that if I have a nurse around me, I can just, say I have a headache, and the nurse, thinks that she's saving life. and give it to us. So as pharmacologists, we have to step forward. So for instance, no offense, if a pharmacist is having a meeting or the pharmaceutical society are having their meeting, we are not bothered. But when pharmacologists are having their meeting, pharmacists have to be there, because it might be in that meeting that we are closing down your pharmacy. It might be in that meeting we are closing down your hospital. How? We might just say, oh, agbo that is commonly used in Nigeria, for example, should be banned. Why? Because I tried it on my rats, or I tried it on a few patients and they had cancer. So if we say that agbo is carcinogenic, then the producers of agbo will start running after us. So that is why scientists, especially pharmacologists, do not have friends. We try to keep to ourselves because of the nature of our job is sensitive, and I believe that the nursing profession should be that way. During the COVID-19 pandemic, it was discovered that countries where women were the leaders had the least numbers of COVID victims. I do not know how that is true. Somebody might just do a research and just find out, But if we look at it truly with a third eye, without any research, it's obvious that countries that are headed by women, you know, did not suffer much from the impact of COVID-19. And countries that were headed even by Africans, you will see that Africa did not suffer much from COVID-19. Now people will say, oh, Africa is dirty, Africa is unhygienic, they have dirty water. People here in the UK are raising money. Oh, they're drinking dirty water in Africa, water aid. Well, how come countries that are supposed to be clean in quotes, suffered more from COVID pandemic than African countries? So that means a lot is being distributed on the news, social media, various things about Africa. However, we need to stop labeling countries and saying, oh, one country is dirty, because it was assumed that if you wash your hands regularly, you won't have COVID. I mean, people in Africa, we know that when they eat puff puff, for example, after eating it, the oily thing, people just rub on their head and, it's shining, they laugh, so if COVID, really is that bad, then how come Africa was not as affected as people thought? My concern is that healthcare workers are waiting in the hospitals for patients to be brought to them, and that is where the problem is. As a nurse, you should be on the news. You should be finding out how many buses are traveling today, um, how many planes are going out today. For instance, I'm happy that your mentor here is my mentee, as I always say. So she is a mentee and she is your mentor. So that means, coming under me doesn't mean I'm her superior, but she's still learning, even though she's your mentor. So while learning from me, she is my air ambulance nurse, meaning that when we produce a plane and we say, okay, this plane, we want it to be a 5-bed, she is the nurse on that project. She should be able to say, yes, this plane is good, but I will not be able to approve it. Health and safety. Why? Because the stretcher looks bent. If my patient is on it, it's going to fall. But healthcare workers are not involved in building of ambulances. They are not involved in building of air ambulances. So when the finished product is brought to your hospital, you have to manage whatever is being brought. So a lot of things are happening. Healthcare workers just manage, manage, manage. But if you are there, out there, you should be able to say, no, I do not want this paracetamol at my border. My country is not going to accept this paracetamol because it has 3 months left of it. So for those of us we in pharmacology, pharmaceutical space, we understand the importance of governance, and that is why agencies, food and drug agencies all over the world, they are very strong. As a nurse, you shouldn't just wait for a drug to be produced. As a nurse, you should, be part of the clinical trial process. Nurses can take up careers like clinical trial nurse. Not just is it an a career that one is proud of. It's, it pays well, because for instance, if I find out that the paracetamol that is in the market is not good for maybe a Caucasian, is not good for an Indian, oh, I now have my own paracetamol. Based on my experience on the world, I found out that, oh, one paracetamol tablet, 500 milligram, or we say, oh, 2000 milligram, because he drinks, because of the influence of alcohol. A nurse should be part of the clinical trial process. A nurse should be able to say, if you test this drug, it's going to work, but it will not work on patients who take alcohol. It will not work on patients who take who smoke, for instance, or it will not work on my patients who is obese. So the nurses are the ones on the field, while the pharmaceutical and pharmacology, team, they're making the drugs. They might not actually see what's happening on the field after the clinical trial. Look at COVID-19 pandemic. When the drug was tested, it was done twice. People were taking 2 jabs, and the drug was approved. So why are we taking a booster? If you say this drug has been approved and we have a first dose, we have a second dose, now what is the impact of the third dose? We do not know. So I must say it is like the world is part of a major clinical trial. We are all, subjects of a clinical trial, the largest clinical trial in history. So if you have taken a COVID jab, you are still undergoing, you know, that clinical trial, because we do not know if people take a fifth dose, maybe they may start going deaf. We don't know. We're still studying. And so that's why drugs take about 10 years before they are approved. However, because of the impact of the COVID pandemic and because of governance, that's where I'm going now. As healthcare workers, we can, change the timing and say, yes, it should take 10 years for this drug to be approved. But if we wait for 10 years, probably the whole world, you know, will be gone. People will just be dying once they have COVID. They just, fall off. So the COVID vaccine does help. It doesn't mean that you are not going to have COVID again. It just implies that if you have COVID, the impact will not be as severe than if you didn't. This does not happen in all cases. So when you see somebody is a healthcare worker, she's in human rights. I studied Black patients. I compared males and females back in UCH, and that research was loved in California, loved in Britain, and that's still my best research. The research I did at University College Hospital, that's UI Teaching Hospital, is my best research so far, because I was able to say, yes, this drug works, but in Black people, this is how it works. So if we can make medicine individualized, patient-centered approach, how would we accomplish this when the only place we go to is go for morning shift, go for afternoon shift, and that's it? Weekend, maybe I pick a night shift, pick a long day. Okay, let me work on Christmas, maybe I get double pay. No, as a nurse, you should go beyond that. So I'm extending an invitation. I hope Nurse Olayinka Remu doesn't mind. I've invited her as well. If you're interested in joining the International Human Rights Commission, I am a healthcare executive. I am a pharmacologist. I have a BSc in biochemistry, then master's in pharmacology, and then I ended up, doing neuroscience research, which led me to become a healthcare executive. So, as a healthcare executive, I can manage any part of healthcare service. Now, why would I just sit down in a hospital and wait and say, oh, maybe 10 people died? Let me just write the notes. Let me do my reports. No, we want to be out there. We want to be in the White House. We want to be in the House of Commons. My society was supposed to send me to House of Commons, that's here in Britain, to represent the British Pharmacological Society. And they said, scientists, go there to tell the politicians what you want. And my proposal was that scientists should be part, of science fiction movie, meaning that if a science fiction movie is being approved, scientists should be part of the production team, because our children are watching rubbish. I volunteer to teach students science, and when I'm asking them questions as a real life scientist, they're answering me what they saw in Star Wars. They're answering what they saw in Spider-Man, and it's correct. According to Spider-Man, according to Star Wars, according to Eva, is all correct. But that's not true science. Now, when we talk of inclusion, equality, we've been reading books where our scientists are white. We now need to create books where our scientists are black. We have a lot of black scientists doing wonderful things. We have a lot of Asian scientists doing wonderful things. We have a lot of white scientists doing wonderful things. So we need to, for more people to come into healthcare, for instance, we need to let them know, that, oh, this is what this person is doing and she's from Nigeria. People are always surprised. They keep calling me British American, and I get offended. I am Nigerian, and I hope that it will stay that way. I am proud to be Nigerian. When you do something great, people say, oh, she can't be Nigerian. And I said, do not insult me. I am Nigerian. So I want to give you that charge today. International Human Rights Commission with free membership. I can recommend you as long as I know you're a fellow healthcare worker, and we're in this boat together. We cannot just wait, and have people producing drugs and bringing it to, oh, it's almost expired. Don't donate COVID vaccines to me. I don't have COVID in Nigeria. Why are you donating vaccines to me? Keep it. You need it more in your country. So we should be able to say, we don't want your donations. We have our own vaccines. Dr. Yowande is a pharmacologist. She just made a vaccine and it can be used for Black people. You tested your vaccines in white people, so why are you bringing it here? Keep it there. You tested your drugs in Asian people. Why are you bringing it here? And from my research, the best drugs for Africans is those made in Asia, because racially, that's our closest match. So with that, I'll finish my speech, and I'll say congratulations for everybody, who's having their graduation today. Thank you. You're on mute. Alainka, you're on mute.
Oh, so sorry. Yeah, thank you so much, everyone. Thank you for calling my attention to that. I really want everyone to help me appreciate my mentor, Dr. Yewande. And, your mentor is also a mentee, has a mentor. And I have another mentor here as well. She'll be coming on board now. Dr. Yewande, she's on my neck. That's one thing that mentors does. Like, they won't let you go. Like, they want to see you succeed. They want to see you, get to your full potential. She has seen something in me, maybe that I haven't even seen myself. And she keep pushing. And I felt like she's so involved in all these international policies, governors, trying to make things work. Why can't we bring such to the Norse Academy? So it's a pleasure to have you, Ma. Thank you so much for sparing the precious time to join us here. I am a mentor. I'm a medical translator training with WOP, and as well ambulance nurse. Okay, so thank you so much. Can you hear me? I can see from YouTube said we can't hear you. Can you hear me now? Yeah, so, and of course, if you want to volunteer with International Human Rights, we have a huge project, a huge model that we are working on. Please, you can contact me. I can be your link person and we can get this work. Remember, what Dr. Yewande was really talking about is how we can get involved in international policies and governance. So don't just be the user of all these policies. You can also, be part of the decision making. Thank you so much, Ma. We'll be in touch. If you have any question for Dr. Yewande, you can leave it in the chat box and she will attend to it. Thank you so much.
Thank you.
Okay, Oluwatobi, we're back. So thank you everyone for joining. If you're just joining us, you can let us know where you're joining from in the chat box. We are onto the guest presentation. We just finished our guest presentation from Dr. Yewande, and we will be going straight now to a goodwill message. I'm going to bring up in Oluwatobi.
All right. Okay, we're going to be moving on to the to another group message. Like we said earlier, we're going to be shuffling in between the guest presentation and the goodwill message. I hope you are enjoying yourself so far while we bring the next speaker on board to give a goodwill message.
It's Dr. Ogufowokon. And to introduce and to read the citation, okay, it's no other person but myself. Myself will be reading the citation now.
Wow.
And to be honest, I had to sidetrack all the other mentee alumni or enemy alumni. They were dragging this with me. I said, I'm going to read the citation of my mentor.
Wow,
yes, I want to be the one.
wow.
I've waited for this opportunity. Let me just pay. I waited for this opportunity, and I told her, I said, Ma, I want to brag about you. And that's what I'm that's what I'm going to do. So because of our time, I wish I could say a lot of things. But first of all, I just want us to appreciate and welcome Dr. Adeshola Ogunfowokon.
Thank you. Thank you. Thank you. Thank you.
That's first to go. And to also let you know, Dr. Adeshola Ogunfowokon is my, should I say was or is? Okay, was my school mother at the university. Do you have school mother in university? I think the last time people have school mother is secondary school. But she was my school mother in the university, my lecturer, my supervisor. She was my BSc supervisor. Oh no, my RN supervisor. What did we even work on? I can't remember.
Hand washing practices of nurses.
Compliance. Can you remember? So I worked on compliance of the nursing student or nurses on compliance about hand washing. She was a mother right from part 1, part 2, part 3. So she's my mother and a mentor. You know, when Dr. Yewande was saying something about what your mentor does, she pushes, sees some potentials, and she doesn't want you to give up. Keep doing this. And sometimes she just Olayinka, are you sure you are doing this? Keep it up. And your mentor also pats you at the back, not like they're just taking you for granted, but they give you that opportunity, that sense of you can do it. So Dr. Ogufowokon, I'm just giving this background information. So let me go to the citation properly. If I start the citation, we will not finish, but I'm just going to be brief about this. So Dr. Adeshola Ogunfowokon, like I mentioned, I say she's at the moment the associate professor. Can you hear me say associate professor? Or in the Department of Nursing Science, Obafemi Awolowo University, of which I am an alumni. So she's also the president of the Alpha. I hope I get that right now. Alpha chapter of Sigma Nursing. If you know Sigma, she's the president of the Alpha chapter, which is the Nigeria chapter, the first and only for now, in Nigeria chapter. Thank you so much, Ma. She, like I said, she's involved in so many international research. She has presented in 2013 international nursing research in Czech Republic. She has been to the US presenting. She's majorly focused on cutting-edge research in the field of school health, adolescent, reproductive health, and a lot of other things. So a passion for enacting positive change does not stop, with research. She's encourages nurse researchers like myself to go after research grants that Sigma offers. And I want to say categorically, for those that know, that I was awarded a small research grant from Sigma of recent. I want to say she was one of the people that encouraged me. When I joined Sigma and I told her that I joined Sigma, she told me, she said, make sure you are active. I cannot forget that what she said, make sure you are actively involved in Sigma. So I'm all there trying to get every opportunities. And luckily for me, I got this research. She said something in her words from one of her write-ups. Maybe she cannot remember, or she doesn't know where I found this. She said, I have made many efforts previously to fund my research, but the Sigma grant is the first grant I will ever receive. And just like her, Sigma grant that I received was my first ever grant that I ever received. So thank you so much for that encouragement. I'm going to stop here. I'm going to invite, Dr. I hope I still have her head, Dr. Adeshola Ogufowokan on the podium to talk to us. Just a good message from her very briefly. She was in the meeting and then she's back to us now. Briefly about community partnership.
I can't hear you. Am I muted?
I can hear you, Ma. Can you hear me now? But we can hear you. Can you hear me? Okay, Ma. We can hear you, Ma. Go ahead, Ma. Can you hear me, Ma? Can everybody hear me? If you can hear me, can you just drop a chat so I know you can hear me?
Ms. Kochola, I can hear you clearly.
Can you hear me? I can't hear you.
Yes, Ma. I can hear
Can
you,
you
Ma.
hear me?
Yes, Ma.
Yes.
You can hear me, but I can't hear. So what is happening?
Okay, Ma. That's fine. You can go ahead. Since we can hear you, that's more important. You can go ahead, Ma. Can we ask if she can hear Toby?
Ma, kindly check your system volume control. It might be from the volume on your system, ma.
Okay, I'm just going to.
I have lost track of all the discussion. What happened was that I changed my device and I don't know what is happening. Maybe I should go back to my previous device.
You can check your. Let me just call her.
Oh, okay. Okay, while we wait for the technical.
Hello, can you hear me? Hello, Alayinka.
Right, guys. So while we wait for the technical issue to be sorted, okay, if you have any question or anything, any clarification you would like to make about Norse Mentorship Academy, you can just let us know in the chat box. So once again, this is Norse Mentorship Academy, where we build and empower and build capacity of young nurses and aspiring healthcare professionals to be able to participate and contribute, to the global economy, to the global, positivity in the healthcare profession. So, guys, we are still on to Norse Mentorship Academy, and okay, let's check if the technical issue have been fixed now.
Can you hear me, Ma?
Yes, now I can hear you. I think I've missed a lot of things that you have said.
Oh my God, all my bragging. You did not hear any of all my bragging.
I did not. The last one I had was what you did during your RN project. That was the last thing I had.
Oh, okay.
After that, I lost track of everything.
Oh my God. All right. Please, I want to create the indulgence of all our listeners. And I know we are far behind time, but it's really important that we give honor to whom honor is due. And my school mother right here and my mentor deserves, a standing ovation, I would say, from me. So I'll just go quickly through again about citation. So we'll talk about what we did. Just want to say a few things about her. Like I said, she's the associate professor in the Department of Nursing Science, Obafemi Awolowo University, of which I am a product. I'm an alumni, 2011 set. So she was my school mother, my mentor. and support, caring, and that motherly touch away from home. She's always asking, how is mommy, how is mommy? I don't even think she has ever met my mom, so that's just an unofficial citation anyways. But just to also let you know, she's the president of the Alpha Sigma chapter in Nigeria. She's the founding president and the only Sigma chapter in Nigeria now. So she's doing amazing work. And at the moment, they're preparing for the first international conference, which is actively involved. She has strong passion for positive change, and that does not even stop with research. She's involved in a lot of research. Her main focus and field is sex, school health, adolescent and reproductive health. She's an innovative nurse researcher. She has presented in multiple international conferences. She was offered a Sigma small grant recipient. She was a Sigma small grant recipient to further her research on sexual abuse experiences and the effects of educational interventions. And these has actually been a very productive and remarkable work. Like I actually said, though she didn't hear, I saw this write-up somewhere, she might not even know. In our words, she said, I have made many efforts previously to fund my research, but the Sigma grant is the first grant I will ever receive. Don't be discouraged. Sigma makes it easier for nurse researchers to get funding for their proposal. Yes. And just to let you know, when I joined Sigma, I told her about it. And, she told me, she said, make sure you harness every opportunity you get involved in Sigma. And to her credit and to the glory of God, I was awarded my first Sigma Scholar grant as well. So thank you so much for that encouragement. That shows, what mentors does. They push you, they give you the opportunities, they show you the way, and they also encourage you to go further. Thank you so much. We're going to have Dr. Adeshola Ogufo. Welcome, please. Let's give her a round of applause as she gives us a goodwill message.
Thank you.
About community partnership for healthcare professionals. Thank you, ma.
Thank you very much, Mrs. Aremu, and a doctor to be. I want to once again say that you are doing a very good job. Most of the time when I see you on social media, I'm always proud of you, and I feel so, fulfilled that at least one of my students is doing very well and is impacting the global healthcare system. And recently you got this award of the, I think, African Nurse Change or something like that. I want to say congratulations, and I pray that you will get more of these accolades and you will get the peak that you so desire. It's an honor to be here to give goodwill message to your mentee. And I'm not too sure whether these mentees are Nigerian-based mentees or they are mentees in diaspora. Okay. Yeah. All right. So let me congratulate you that you mentee, you have a mentor, for if you see an individual that is doing very well in every field of his or her endeavor, you should know that there's somebody who has been that person's mentor. There's somebody who has been lifting that person up, who has been showing that person, direction. I, as a person in my early career, I never had that opportunity, of a mentor. That you have a mentor, I think is a great privilege, and I think you should appreciate that and appreciate your mentor, because it becomes easier for you to be focused. It becomes easier for you to know what you want to do. It becomes easier for you to tap from, the knowledge and tap from the skills and tap from mistakes and challenges of your mentor. And that actually helps you to have a speedy growth in your career. So I say congratulations. Olayinka has asked me to talk to you, maybe my goodwill message to be in the area of community collaboration. And I think that is the aim thing now. What WHO is asking for is that we healthcare professionals go into the community, because that is where the issues are. Go into the community and impact the community. As a community health nurse, as a community person, I have always seen it as a great privilege, a great opportunity to come into the scene before that healthcare problems becomes an issue. before that healthcare problems take that individual to the acute care setting. I always see it as an opportunity to be there, to intervene, to disrupt that progress of healthcare problems. So as a mentee, you have that great potential to impact the community. And there are so many ways you can do that. Now we are talking about COVID-19, we are talking about cancer, increased rate of cancer in the community. As a healthcare professional, you can be in the community to tell the community members that, look, you don't have to get cancer, you don't have to get COVID-19. These are the things you should do. And we need people like you to be right there in the community to tell people what to do, what not to do, what they need to put in place to prevent themselves getting to the acute care setting, getting to the operation table, getting to the chemotherapy table. You need to be there to give them that information. And as a community health practitioners, these are the things that you can contribute, to the community. And I want to encourage you that as a medical graduate, knowledge changes, knowledge progresses. Now we have had, knowledge explosion in the healthcare system in this century, and you cannot afford to be lagging behind. What I mean by that is that you also need to continue to update yourself. Update yourself in your areas of skills, update yourselves educationally. Gone are the days when BSc has been, the peak in nursing career. When you get your BSc, people feel that, oh, I've arrived, but now it's no longer so. You've got to go ahead with your MSc, your PhD, and you need this knowledge to impact your community. I have been able to work in the area of school health programs. And over the years, I realized that school children, they lack healthcare knowledge. The healthcare knowledge of so many health problems is really, really lacking. Sometimes when I get to schools, you hear school children asking different kinds of questions. Questions like, anytime I want to urinate, I have pain, what can I do? Oh, my eyes has been itching me, what should I do? I have gone to the pharmacy store, they gave me this drug, it's not working, what should I do? Oh, my menstruation is this and that. And I realized that, oh no, there is this dearth of health knowledge among our school children. You, as a healthcare professionals, you can go to schools, give them this information. Don't wait till the time when a teenager has pregnancy. Don't wait till the time when a teenager has gonorrhea or has syphilis, has sexually transmitted infections. Don't wait till the time when a school child, is now having, poor educational performances as a result of, high problems. You've got to be there to detect. As a community health person, you've got to look into the future. Don't wait till when all these health problems start to manifest. You've got to be there. Maybe peradventure your interest is in women's health. Some time ago, I had this MSc student whose research was on obesity among market women. And when she got to the field, there were so many findings. Market women with obesity. And because they get involved in sedentary lifestyles. There are so many issues relating to the sedentary lifestyle, health issues that were manifesting in the lives of these women. And she came back and said, wow, there are so many things to do in the marketplaces. We need healthcare services for market women. We need to have a healthcare clinic, a health clinic in the marketplaces. There are so many things that you can do. And that's the reason why today, as a community care practitioners, you can have your non-governmental organization, you can have a non-profit organization where you are there intervening every 24/7. Don't allow them to get to acute care setting. Be there to intervene, be there to prevent, be there to screen and advise, be there to refer before it's getting too late. There are so many things you can do. And of course, I as a researcher, I should be able to tell you that when you are doing all of that, one way or the other, you are collecting data. You are realizing that, look, women have these health problems more than men. You are realizing that preschool children have this problem more than school children. And so, as a community health nurse, these are the things I can do There are so many things you can do. And you know, as a community health practitioner, you can collaborate with so many people to make the life of the community members better off. You can collaborate with so many people. You collaborate with physicians, you collaborate with pharmacists, you collaborate with water engineers, you collaborate with environmental health officers. Why? Because when you have human beings, there's bound to be one health challenge or the other. And you've got to be there before the health challenge starts to raise its ugly heads, before it starts to manifest. So you have so many things to do, so many things to do in the community. Are you talking about people in rehabilitation centers? Are you talking about prisoners? Are you talking about employees in terms of their health based on the kind of job they do? Recently, I took my student to the International Breweries PLC in Malaysia, where they produce alcoholic drinks and non-alcoholic drinks. And we try to, observe the healthcare practices that you have there in terms of occupational safety. So as a community person, those are the things you also need to get involved with. So many employees are there because of what they will eat, because of what they will do. There are lots of health challenges they are facing in their various health, workplaces that the employers are not even looking at. But you as a community person, you as the occupational health nurse, you can be an advocate for these people. So the field is ripe. The field is quite ripe in the community for you to go in there and, positively impact the health of community members. So once again, I say congratulations. Congratulations that you have a mentor. And I want to encourage you, keep on tapping from your mentor. She has a lot to give you. I've listened to many of her, presentations. I have read many of her stories on what she's doing as a coach, what she's doing as a mentor, and the likes. You have a lot of things, to learn from her. And I want you to, even though you are graduating today, let me advise you, don't detach yourself from her, because you will still have a lot and a lot. You know, to me, as a mentee, you don't graduate. That's my own mentality. As a mentee, you don't graduate, because that your mentor is always up there, and the experience you cannot compare with your own experience. Even though formally you graduate, but informally don't graduate, you still have a lot to tap from her. Thank you. I want to say congratulations to you, and congratulations to Olayega too for being that mentor that nurses need at this point in time. These young nurses needs you, needs me, needs the experienced nurses to guide them to be able to get to their career. Well done for what you are doing, and congratulations to all of you. Thank you
so much, Ma. Thank you so much. Please, let's appreciate. And something came to my mind now while you were speaking. At our final year seminar, BSc seminar, I was the class rep for 5 years, and you were invited. I don't know if you still remember. You were invited to speak, and you spoke on nursing and entrepreneurship. That topic, I don't know why we chose it. I want to say, even during the presentation, everything was entering one here and then coming out from the other here. It wasn't real until I started doing business, and then really got the real grip of nursing and entrepreneurship. And thank you for that. At least that foundation. And I can never, anytime I remember, I just think back, okay, Dr. Ogufrawokon, gave us a lecture on that. And it's just, opportunity is so wild there. And you just have to take those opportunity. And I'm still a mentee, like she said, you can never graduate like that, don't detach yourself. I still go back to her. Sometimes I just say, Ma, this is what I'm doing. Can you just put me right? So that is the power of mentorship. So thank you so much for coming.
Thank you too.
I do really appreciate it. Thank you for not staying too far away from me. God bless you. Thank you, Ma.
Thank you for making us proud too. God bless you. Yes, greetings to your family.
Thank you, Ma.
Bye.
Thank you.
Bye.
Let's appreciate a round of applause. Thank you.
Bye.
Hello, Toby. We are back. Oh my God.
Right, it's been an interesting and awesome moment. I don't know if you are enjoying yourself, but really, I'm enjoying myself, and I'm learning as much as possible. And see, let me even show you. I have some notes here. I'm taking notes. My note is full, and just
Thank
learning
you.
and putting down a lot of things. It's been an interesting moment. All right. Thank you so much, Ma. Thank you so much. There is one point she made, and I'm going to emphasize that for every mentee. I told you that I was in the first cohort of this mentorship program, and one thing mommy said was that mentees never graduate. I'm a testimony. Please, as you're leaving, don't detach from us, Cochola. Hold her neck. Hold her neck. Press her neck very well. Don't leave her. There's so much to learn from her. She's going to challenge you. I mean, she will push you and bring out the best in you. Thank you so much. And even this I'm doing today is a product of one of those push and one of those pep talks she gives to me once in a while, right? So thank you so much, Nos Cochola, and to everybody once again, please hold Nos Cochola's neck. All right, so we'll be moving into the next session right away. Okay,
I
Cochola,
think
what
we
will be
can
happening
we
next?
can talk about e-mentoring now, and then we
Okay,
will take the other Goodread messages. So I have the other Goodread messages, and they are pre-recorded, so I'm going to be playing that one those later on. So I think we can talk about the e-mentoring.
great, great. Okay, thank you so much for the opportunity to talk about uh, this Norse Mentorship Academy mentoring session. A second, please. Trying to just check out something.
Yeah, why Luatobi will be talking on that. Just for us to know, we are launching the Emerge Mentoring e-learning portal from September. This is a great opportunity and to really help us with a lot of challenges that we have had over the years about the Norse mentorship, the Zoom classes, network failure, audio. So the mentees will be able to go through all the modules, all the courses at their own pace, at their own time, at their convenience and all that, and still keeping up with the classes. You still have your one-on-one mentors, you still have access to your mentor, you still have the one-on-one, you still have every other thing attached. So that's just an introduction there.
All right, thank you so much. Okay, in the next 5 6 minutes, so I'll just tell us about the e-learning portal for the Norse Mentorship Academy. You'll quite agree with me that this is the 21st century, right? And it's no news that everything is going digital. I mean, even to the various thing you could think about. And one of those sectors which is making use of technology and digitalizing your services and the practice is the educational sector. And now we could link this mentorship academy as a form of educational or training institute, right? And like Nurse Kochola said, in the past, a number of challenges have been encountered when it comes to network availability. Sometimes people not being able to catch up with some scheduled lecture and a number of other things, right? So this is why Nose Mentorship Academy, which is duly headed by Nose Cochola, as we all know, came together with the theme and developed a solution to that to those challenges that have been identified. And the solution that we came up with is the e-learning portal where students can go online through this portal, have their mentorship session. Now, during the introduction of this graduation ceremony, when Nurse Kutula was telling us about Nurse Mentorship Academy, she mentioned the modules, right? She mentioned the modules and some things that are to be covered in the during the mentorship session, right? So and we have I think about 6 7 modules where we talk about public speaking, where we talk about a lot of other things. Now these contents have been put together in one place. Now, as you can see on your screen, I believe you can all see the screen that is being shared right now. As you can see on your screen, we could see some of these modules, setting goals that work, discovering your true self, and there are other modules like public speaking, time management, and all those things. Also, there are some elective courses and elective modules as well, right? So these modules have been put together on this platform for you to access at your pace easily, right? The content, the video content, the transcription content are all available on the platform for you to use for your mentorship training. Now, I would like to mention is that this does not completely eliminate your one-on-one interaction with your assigned mentor, right? Even while you register and log on and take these modules on this platform, you're still going to be having your one-on-one interaction, direct contact with your mentors, because this is very important when it comes to mentorship. So this does not eliminate that part, but this platform makes it easy for you to access those modules, right? And on this platform, as you can see on your screen, we have different pages. You have the home page where you can access the modules directly. That is the landing page, right, where you can access the modules. You have the another feature of this platform is the about us. If you want to see, if you want to know more about the Norse, the mentorship program, you can just check the about us link. Also, if you would like to reach out to Norse Mentorship Academy, you can make use of the contact us page, right? We have the contact details of the Norse Mentorship Academy. And another feature here is the login and registration. As a mentee, when you want to make use of this platform, you would have to log in and register, log in your details. I mean, register with the required details you can see on your screen. You have your first name, your last name, your username, your email address, and your password. Also, you have to confirm your password as well. So these are the things that will be required of you as a mentee to register on the platform, and then subsequently you would have to log in to be able to access your dashboard. Now, in your dashboard, you will be able to see the courses or the modules you're currently taking, your progress, your accounts and registration details, and every other thing you need to know about yourself. You can set up your account from your dashboard, and any other thing you need to know about your account. Also, you can see on the landing page, you have all the courses uploaded already. So once you log in, once you register and log in, so you can be able to enroll for any course you're willing to take. Now, this is very flexible. You can decide to start with any course, right? Note that if you are not registered, you can't enroll in any course. So a criteria to enroll in the course is you have to, register on the platform first before you can be able to access any of this course. So basically, and in summary, this e-learning platform is going to make it very easy for the mentees coming in, I think by September. The next course will be coming up by September, right? So it's going to make it very easy for the mentees coming up to access the courses, to also learn at their pace without the frustration of network failure. I can't hear what you are saying. The network is bad. I'm on transit. I can't catch up with the scheduled Zoom meeting and all those complaints that we do have, right? So this is what the e-learning platform is going to be solving for us. So I want you all to anticipate the launching of this platform. Also, if you have anybody, really, if you are here on this platform right now, I would like you to recommend at least 2% to participate in the upcoming cohort. That is cohort 3. So I'm going to implore you to recommend your friend, your siblings, your sister who is in the nursing profession, or who is looking to go into the healthcare profession. Recommend them for this mentorship, and believe me, it's going to do them a lot of good, right? So thank you so much. That will be all on the introduction of the e-mentorship platform. Thank you so much, Nurse Kochola, for the privilege.
Thank you so much. Okay, so thank you, Oluwatobi. Our time is fast, and honestly, I think just because of all the, the backlogs and the timing and the network issues like that. So, thank you. everyone for joining. We are still here, and we're supposed to have the next thing to be peer presentation, but like we said, we are going to skip the peer presentations and put it up together and put for us to really enjoy. So I want to take this opportunity. We still have 3 goodwill messages that are pre-recorded. I'm going to be streaming, but I'm going to be inviting one of the mentees to share their mentorship journey. So this is the aspect where you have to share your mentorship journey. So Mohammed Sori is here from Sierra Leone. I'm going to invite Mohammed to share just in 1 minute to share your mentorship journey with at the Norse Mentorship Academy with our audience.
Good evening, good afternoon, good morning from wherever you are getting me. First of all, I want to say I'm sorry because I came a little bit late. I'm not too feeling bright. That's the reason why I'm late. To start with, in 2020, late 2020, around December, we have a 5 days breaking boundaries. So I met with North Kuchola in 2020 December, and early 2021, she decided to establish the Norse Mentorship Academy, and I'm one of those that's fortunate to be in the first cohort. After I completed my journey with her, of course, I explained to her what I carry on a daily basis in my workplace, and she thought it fit that I supposed to be part of her. We started a program, the Norse Feeding the Elderly, which we commenced on December 2021, and we are now on total care of elderly in Africa, but we are running it in Nigeria as the first place. And what so far I've benefited a lot from Norse Kushola. To start with, after graduating as a Norse Mentorship Academy, immediately I gained promotion in my workplace. That's, I want to say bravo to Norse Kushola, because from the skills, whatever I learned to her, I implement at the end of the day, I fortunately implemented. Then recently, I've also gained an admission to do a project management course in one of the university, that's University of Washington, as a project manager. So I'm currently working on it. And so far, anything so far I had, I have to communicate with her because she has been a backbone for me. I'm so I'm so delighted to have you as a mentor, and you will continue to be my mentor. I want to stop here because I'm not that feeling too bright.
Okay. Thank you so much. Thank
Too
you.
much to be on my back.
Thank you so much, Mohammed. Thank you for sharing that. And I really wish you a quick recovery. Please do take care of your health. Thank you so much. Okay, thank you. I'm going to bring in just one more. Oluwapelumi, are you happy to share your mentorship journey?
Good afternoon. Good afternoon, everyone. Can everybody hear me?
Yeah.
All right. So I'm Oluwapelumi Emmanuel. I joined Norse Mentorship Academy. That was last year. I was part of the Cohort 1. So I just happened to see, let me say, an advertisement on LinkedIn. So I was like, okay, wow. At that point I just finished from school, and okay, I know I wanted to do a lot of things, but I was not able to like channel all my ideas into just one thing to achieve something. So when I saw Norse Mentorship Academy, that there was something like a mentoring school, I was like, okay, I think this is what would actually help me. So and one thing I would say that I was really happy about in the
Okay, I think we lost you there. Pelumi.
Yeah, I can still hear you.
Okay, go ahead, please.
Okay. So it's one thing that you are coming into something and you are told this is what you will get, and then when you come there, you are not getting even up to half of what you are told you will get. So one thing that was really amazing in Norse Mentorship Academy, all through the 3 months I spent, was that it was more than what you have said you would actually get. I could remember my one-on-one section with Nurse Coach Ola. Before having the session, I was like, okay, what am I to say? How am I to put my ideas? And but it was easy. The accessibility was there. It was easy to relate with the mentor. It's just like it brought down your fears. It brought down probably maybe you're scared. Okay, am I going to say rubbish? Am I is
Okay. Come back here, Pelumi.
oh, can you hear me?
Yes, we can hear you now.
Okay. So that was something that was really amazing. And one of the sessions, the classes we also have was also on public speaking. That was so enlightening, and because I wasn't generally somebody that would want to talk to people, I just prefer being on my own self. But from the classes, it was just a push that you could do better, you could be more than what you feel you are, and that was impactful to me. Then one thing I will also say is about the tasks we were given at Norse Mentorship Academy. One thing I love about it was that it was personal. It wasn't just an assignment you do or you feel you can copy from somewhere. It's something that is something personal to you that you have to um, think about that. Okay, and it is something that is effective. That's the word. It's something effective. You are doing the assignment at the same time. You are putting you are doing something to yourself. It's not just that you are just doing the assignment. So and that's something that is so amazing. So Norse Mentorship Academy has been a blessing to me, and meeting Norse Koshola has also been a blessing to me. So that's what I'll say for now. Thank you.
Thank you so much, Pelumi. And just for the interest of everyone, Pelumi, after our graduation from Menos Mentorship, I don't know if he said that, she volunteered at one of the projects I was anchoring, the Respo Health, first made us is Respo Africa. And, she was so committed with the first project we had, our baby project, which was the Feed the Elderly at Christmas. Our enthusiasm, our passion, our zeal handle the position of a project manager, the project director, Nigeria. So Pelumi is actually the project director of Respo Health in Nigeria. And she actually earned that position. So thank you so much for everything you do with Respo Health. Thank you very much. Thank you for giving back. Okay, so I take one more. I know we have other people, but I'm so sorry we won't be able to take all the mentees that really want to talk. I'm going to bring in here Deborah. So Deborah to share our Norse mentorship journey as well.
Good evening, everyone.
Good evening.
Yes. Thank you very much for this great opportunity. Yeah, it's been a beautiful journey for me at the Norse Mentorship Academy. I joined the second course midway, but it's been an awesome time for me. If there's anything I so much appreciate about the Norse Mentorship Academy is that Norse Cultural is accessible. Just drop a message for her and she will respond. There are so many people that offer mentorship programs or mentorship access, but they're not really accessible. Seriously, they're not really accessible. But North Cultural is very accessible, and at a time At that time when I got into the academy, I had a lot of ideas, I had a lot of things. Yes, even though I was mentoring some other students, but there were some things about myself that I needed to be clear about. So I booked a mentorship, a clarity section with her. And while I was talking, the first thing she said, she asked me, she said, "Have you written these things down?" And I was like, "No, I have them in my head." And I felt like, "Oh, there's no way I'm going to forget these things." So it's like I carry them everywhere I go. And she said, "No, you just have to write them down." And since then, I started going out with um, a book. Whenever I have an idea, I just have to pen it down immediately. And it's been very it has made me so accountable. So many times I have to go back to that book. I have to look at it and I say, "Oh, I think I still have this goal to achieve. I've not been able to do this. I'm not able to do that." And this is one of the things I benefited while I was with her at the Norse Mentorship Academy. So at the time when she was about to start the book project,
You can hear you.
Okay.
okay,
Even at that,
Okay, Deborah, thank you. You just let us know when you're able to come back. Thank you so much for that. Um,
okay, hello.
okay. Yeah, go ahead.
I'm sorry about that. So at the time when the book project was to start, and she said, "Oh, baby, you're going to be the PRO for the book project." It was a big responsibility for me. I didn't see that coming, but I was able to push myself. And at that time, when the lady was handling the project wasn't around, I had to step in, and I saw a lot of potentials in me that I never knew existed. So the Mentorship Academy gave me that opportunity to, to see myself in a different light. It gave me that opportunity to broaden my horizon. It gave me the opportunity to do a lot of things that I never felt that I could do. And it's I have so much benefited from the academy. I related with Nostropola in so many things that even outside the whole mentorship syllabus, I've been able to discuss life issues with her, and I've gotten a lot of clarity while I've been during my time at the academy and even off the academy. So another thing that challenged me about the academy was the peer project. It's been a while I did a PowerPoint presentation, and she said, "Oh, we are going to have a presentation," and we were paired. I had to start liaising with my partner. We were discussing, and we had to come up with a beautiful presentation. And I sent it to her. She said, "Oh, my, this is beautiful." So, and a lot of ideas that I have, I'm able to share them with her, and I've gotten clarity about a whole lot of things. So, not Mentorship Academy is one academy um, I would tell a lot of nurses, student nurses about. This is an academy that would help you, that would push you, that would help you gain clarity. This is an academy that would help you be the best that you want to be as a nurse. So if you get to the you've not joined the academy, you've not had any section with Nurse Cochola, I think you should book a section with her. And aside from the whole mentorship thing, you have a lot to learn from Nurse Cochola. She has a lot of wisdom. I don't know how she does all the things she does rather. She has a lot of things going on around her, and I'm like, "Oh, how is she able to put all of this together?" So thank you so much for access. Thank you so much for the guidance. Thank you so much for mentorship. Thank you so much for being a shoulder to lean on. I remember your support personally. I'm able to come to you and tell you, "Oh, this is what I'm going through," and you tell me, "Oh, let me calm down." And thank you so much for asking. I really appreciate it.
Thank you. Thank you.
Thank you.
Thank you, Deborah. Thank you so much. And for those, just to chip in again, as a mentee, it's always an opportunity. Like I see that if you're giving back, and thank you for giving. Not every mentee actually see that and give back. Handling the Emerge book project, with the publicity, being the PRO and all that was really, very an aspect for me that was big that you took out, and um you did it well. So thank you so much for giving back. Thank you. All right, guys. we'll take the rest of the goodwill messages before the presentation of the certificate. I'm going to present the certificate, but just let's take this before then, if you don't mind. So again, it's Norse Mentorship Academy. So the first goodwill message I'm going to be taking, please, we're just going to, I think what I should do because of the time is to present the certificate first. How about that? And then I'll stream the goodwill messages after then. So let's do the presentation of certificates. I think that is what we should do now. All right, at this moment, if you are a mentee in the house, can you just signify wherever where you're joining from, just signify where you are. Say, I'm here, or identify yourself in the chat box. And if you're not here, if you're watching anytime, make sure you identify yourself. I am a mentee of the Norse Mentorship Academy. I'm going to be presenting the certificate. And just before then, just let us know that at the initial, we had about 48 intake. Yeah, we had 48 intake. You know, it's the zeal and the passion when people see program they want to join. About 48 intake, you know, registrant. And today we are graduating 23. And that's based on commitment. So when you see a mentorship program or any program like that, paid or not paid, actually this program is a paid one. The first cohort was a free one, but the second cohort was a paid one, and subsequently definitely paid, because we realized that commitment is key. So it's what you're paying for is a commitment fee. It's not actually the value of what you're getting, and all the mentees can attest to that. So commitment is key to the Mentorship Academy. Your zeal, your giving, by your availability. If the mentor can be available, why won't you be available as a mentee? So it is not a student teacher thing, and nobody's going to be chasing you around. You need to be available, you know, to get the knowledge and the skills that you actually registered for. So we are graduating 23 mentees today. Let's appreciate them, clap for them. So I'm going to be streaming here now the certificate. So if you see yourself, just clap. You don't even see yourself, anyone, just please appreciate them. Akawo is the first them. Abo is Shadow Mary. Olakunle, Georgia, Amara, Olabode, Iman, Chile. I hope I got that. So let's give them a round of applause again. Congratulations from the Norse Mentorship Academy. So your certificate will be issued to you and emailed to you, and you can access it. Please, when you get your certificate, just like my mentor told me, Yema Denuga had a lifelong learning project program that I was involved. She said, print it, laminate it, or whatever, colored, put a frame, because you actually earned it. You've put in so much effort to this. So own it, guard it jealously, and protect it. You know, be proud of yourself. I'm proud of you. Continue to emerge. Remember, that is our key here, to emerge and become high performance healthcare professionals. Thank you very much. Thank you. All right, I'm going to go. I think I had to the moderator had to excuse himself, so I'm here to do this. So let me stream our first. Okay, I'm going to be streaming the first goodwill message. And before that, because of our time, we won't be taking all the single citations. I'm just going to introduce the presenter. Yeah. So the first goodwill message is coming from Carl Lorenzo. If you know Carl Lorenzo, can you say hi? I know Carl is watching. He's watching from YouTube. He's watching. So I'm just going to see if I can get the citation here. Carl Lorenzo. So let me just play that and we can hear from him. Just give it some time to put there. So let's listen. Why that is going on there. Carl Lorenzo is a global creative digital. Okay. I'm going to pause that just to read the citation of Carl. Please pay attention. Carl Lorenzo McIver is a global creative digital health influencer. He's a nursing ecosystem architect, branding creative director, and team strategy leader. The nursing ecosystem is an innovation that increases the value of nurses, he said. He's also the chief global health digital officer at Medigital. He creates a brand identity for today's public health need. He has worked with several organizations and held notable positions with a track record of excellence. For instance, he was the chief brand officer for Red Bloodless, creative director for I Can Make It, Fame, co-producer, Yabilane Entertainment, and partner at White Sofa. He's also a video director and art director. You're going to see more of his work here, even in this presentation. You're welcome. Thank you so much, Carl.
My name is Carl McIver, and I represent digital nursing and teleport scanning. And I want to say congratulations to you, wonderful of 2022. You had such a wonderful mentor, and I call her Coach Allah. Now, my translation may be a little shaky, but it's from the heart. I want to welcome you because as nurses, you are willing to go the extra mile. And that's a term that's used often for persons that are willing to just do more, learn more about their profession. The other day, I was listening to a song by Kenny Loggins, and it was entitled Conviction of the Heart. And what does that actually mean, conviction of the heart? It really means someone that is not only motivated from their hearts, but they see a situation and they want to do all they can to be able to help, to resolve it, and they're motivated by their heart. You as nurses are motivated by your heart. You see situations, people that are going through health challenges, and you're willing to go that extra mile. You're willing to learn as much as you can. You're willing to take on new innovation to be able to help such people. And for that, you should be applauded. Well, unfortunately, we live in a society or a medical environment that doesn't often appreciate the hard work of nurses. I hope that my initiatives help change that make it a better existence for nurses just like you. One of the ways in doing that is, and you're probably familiar with this term called digital medicine or telemedicine, which it's a new digital environment. It changes the whole nursing field and gives you now more opportunity to be able to be involved. Now, does the digital field, the technology, invite nurses into this wonderful realm? Probably not. But it doesn't matter. Because when you have the talent, when you have the ability, when you have the tenacity to be going to take on any, let's say, assignment, or to be involved in any type of organization or experience, well, you're willing to do it despite whatever it takes. And that's tenacity that we know that our wonderful mentor has entrusted in you. Every single graduate this year has a responsibility to push nursing further than it had in the past. So the question is, can you take on that assignment? I'm confident you can. And really, it has less to do with where you live, because now we've entered into a new, we'll call it, way of nursing. I deemed it as digital nursing. Now, digital nursing may be a very new term for you because it is. Digital is quite new. Many probably don't really understand it completely. But that doesn't negate the fact that persons like yourself, like me, and I just want to preface this, I'm not a nurse. But in that conviction of the heart, I want to do all I can to be able to not only uplift, upgrade, but reevaluate not only nurses for themselves, but the way others, peers, view nursing. And that's going to happen. With digital nursing, here is an opportunity for you, not only as a nurse practitioner, but as a professional, to be able to take your talent, to take your skills, and apply it within this wonderful, we call it environment or landscape called digital. There's a new category that's out in conjunction with digital nursing called teleport scanning. Teleport scanning is just the ability to be able to remotely scan a person that may not be in front of you, could be miles away, or really actually could be in another country, and be able to find out what's taking place regarding their medical information. And when I say information, vitals. Now, nurses are becoming, and I'll say this, the information that they are able to acquire is not for diagnosis purposes. No, we know that's the role of doctors. But there's plenty of latitude to be able to gain very important information from a person's anatomy, to be able to gain important information where you can be able to help as a healthcare practitioner others. And maybe the information that you're able to glean because of this new category called teleport scanning, you may be able to work and be able to give information to doctors so that they can be able to make best decisions for their patients. We're living in a new environment where nurses can be entrepreneurs, nurses can be bedside, nurses can be consultants, nurses can be teachers. You set the craft. You craft tomorrow. And that's what this is all about. It's not so much about trying to prove that you're a nurse and trying to prove in others your existence or your worth. No, it's not about that at all. It's about how you personally want to drive that path. That's what this is about. And at the end of the day, you can have 99.9% of the people not respect you. But that small little minority, that 1%, is you. And at the end of the day, if you can go to bed and you can lay your head down and know that you've done the best you possibly can, well, isn't that enough? That's enough to be able to help you and fuel you into tomorrow. So when we think of this thing called conviction of the heart, I want you to really think about that. Think about that, what that symbolizes, conviction of the heart. Let that be, let's say, your music, your role music, your motivation music for this year. That you're not going to let anyone stand in your way. It doesn't matter if they're large. It doesn't matter if they're small. It doesn't matter if they may be smarter. It doesn't matter if they're faster. It doesn't matter if they're younger. It doesn't matter if they're more experienced. It doesn't matter their credentials. The only thing that matters is that your conviction of the heart is going to move you to do more in this environment called nursing. And I'm going to tell you, I feel so confident in knowing that your mentorship to this point, your experience, your heartfelt conviction is going to move you not only to be able to satisfy the needs of people today, but it's also going to motivate confidence in this whole digital health environment, that there is the majority of healthcare workers that are doing something, that are looking at the solutions, looking at the patient experience, and wanting to add to this overall structure, this overall platform. You're not going to be left out. You're not going to be left out. And it's not like yesterday's nurses.
Mm.
No. Yesterday's nurses, we can say to a certain degree, were workers, hard workers, and they supported the medical field. This is a little different. Today's nurses are not only supporters of the medical field, but they're contributors. We want you to be a contributor. We're going to be working with nurses and helping to establish what you call a badge, and it's called Digital Nursing Badge. And let that badge, if you decide to acquire it, be your passport, be your entrance into a wonderful world of digital medicine. And when you're in that world, we hope that you do all you can, not only to be able to upgrade the patient experience, but to add to the whole digital landscape, add to this whole fabric called digital medicine, where at the end of the day, maybe 10 years from now, maybe 5 years from now, that when this whole digital environment just began, they can say, you know what? We could not leave nurses out because they contributed to the future and contributed to today. So congratulations. Congratulations. You couldn't have graduated from the best course. Your mentor, our coach Ali, have done such a wonderful job. And we look forward to seeing your work. So remember, conviction of the heart. And I hope to see you, and I hope we get a chance to work along with you. With that.
Wow. Oh. Thank you so much. Wow, 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 wow. Need to stop that sharing. Wow. Who is following? Carl, that was beautiful. Conviction of the heart. That was what I did. Conviction of the heart. That's massive. Power of the technology. You know, how to that. Carl was just talking about digital technology, the use of telemedicine, teleporting, and how we can harness this opportunity as nurses and healthcare professionals. Wow, thank you so much. Thank you very, very much. Yes, I hope you are enjoying this. This is loaded and packaged. This is what we do to celebrate and to usher out all our mentees. Thank you so much, Carl. Thank you. And I'm going to go next. I hope, let me just check the program again. I'm going to take the other Google message. This time around, Victor said something, Obina Victor said, after you have positioned yourself, after you have, you have the platform where you can, show forth your skills and your experiences. Then after you are visible, visibility comes in. Then the next thing is wealth creation, right? So that is why, I thought of, adding this to the core high performance module, or talking about investment finance, talking about wealth creation and all that. And most of the time, you don't find nurses or healthcare professionals doing this. But we are opportune to have, somebody that is a nurse that is also into investment finance. And, it took a while before I could get her, but thankfully, she made herself available. Like, she actually confirmed her availability, and that's the in person of Savannah Arroyo. Savannah Arroyo. Who is taking the citation of Savannah? Pelumi, are you taking the citation of Savannah? Okay, so because of our time, we won't be able to go through this. I'm very sure she's going to introduce herself. So I'm going to share the screen now for Savannah. Please stay tuned.
Savannah Royo, and before we get started, I want to first congratulate you all on your graduation.
Okay, I'm going to take that back. So Savannah will be talking about investing finance for healthcare professionals. So stay tuned, stay tuned.
My name is Savannah Royo, and before we get started, I want to first congratulate you all on your graduation from the Nurse Mentorship Academy. I have been a registered nurse now for over 9 years, and it has been one of the best decisions that I've ever made in my life. It has provided so much flexibility in terms of different schedules, different settings to work in, different specialties. It's allowed a lot of flexibility to my life, and a decision that I'm very grateful that I made. And before we get started talking about investment and finances specifically for healthcare professionals, I want to give you guys a little bit more information about myself. All right, so my name is Savannah Arroyo, CEO and founder of Net Worth Nurse. I am a registered nurse and have been in healthcare for over 9 years. I've worked in a bunch of different settings, med-surg, tele, oncology. I did pre-op PACU, ortho, worked in the cath lab, IR, GI, non-invasive cardiology. And in the last 4 years, I was specifically working in administration. So I was overseeing an ortho practice, all the clinical aspects of that for 3 years. I was a supervisor for that. I oversaw 4 ambulatory orthopedic offices, loved that job. Working in ambulatory setting as a nurse is a really different opportunity that we didn't learn a lot about in school. And so that was a really cool experience. And then after that, I went back into the acute care setting, and I was the assistant nurse manager for the cath lab, IR specials, and then did that. And then I started investing in real estate at the beginning of 2020. So I had just had my second daughter, was really looking for another way to generate multiple streams of income. So I wanted to not be so reliant on my job. And especially as I was coming back from maternity leave, it was a big realization that I had to go back to work when my baby was 3 months old, because I was dependent on a paycheck, and that was probably the last break that I was going to get until retirement. And so when that realization sunk in, I started looking for different ways that I could start investing my money and growing wealth. And so my husband and I started investing in real estate. And so that was when we founded Willow Investment Group. That's our real estate company at the beginning of 2020. And we were new in real estate, didn't know anyone else doing it, had to educate ourselves a lot, read a lot of books, YouTube videos, podcasts, and within, we were really, really motivated. And within our first 6 months in real estate investing, we did purchase 38 units. We bought a couple single family homes on our own, and then started doing real estate syndications. So for any of you guys who aren't very familiar with that, I had no idea what this was at all 2 years ago as well. Syndications are opportunities for people to pool together their resources, their capital, their skill sets, and go out and buy big real estate deals that they normally couldn't buy on their own. And so we go out and we purchase apartment complexes, and we have people who passively invest with us side by side, and they take a very passive approach. And then we go out and we're really active in these investments, finding the deal, doing the due diligence, getting the financing for it, overseeing the deal throughout the lifetime investment. And so that's what we do at Willow Investment Group, is we go out and purchase these apartment complexes, and then we have people who want to get into real estate investing but don't want to do any work, and they invest with us passively. So I have a lot of healthcare professionals who love what they do, love working at the hospital and providing healthcare, and they're making good money. And so they then put this money into these real estate investments, and it's a great way to grow their wealth. So since I've started that investment company, I've raised over $3 million. Like I said, primarily from healthcare professionals. And then through my company, Net Worth Nurse, I've coached dozens of healthcare professionals into their first investments, whether that be real estate or passively investing. And so that's a little bit more information about me. I really set out on this journey a couple years ago as I was sharing what I was doing with real estate investing and growing my financial health and becoming more aware of that. I started sharing what I was doing on social media. And so I'm super active on Instagram, Facebook, LinkedIn, YouTube. even TikTok and Twitter. And I started sharing with people what I was doing in the investing world, and gained a lot of traction, and a lot of people, a lot of nurses and healthcare professionals who wanted to get more information about this. And so through Net Worth Nurse, we started creating dozens of free resources. If you head over to our website, networthnurse.co, there's tons of blogs. There's over 100 podcasts that I've been guest episode in where I talk about my journey. We have downloads and spreadsheets. We also have a couple of courses that are for purchase over there. And so we've just become really, really passionate about sharing all this information with healthcare professionals, because you guys need it. You healthcare professionals are really where my heart is at. And I just want, especially throughout the COVID pandemic, I saw a lot of people get hit really hard financially. And so creating all these resources is really just our way of giving back to the healthcare community and spreading the knowledge of how to get more control over your finances. So I'm going to share with you guys a roadmap that we have, and this is available on our website. You can go over there and download it for free. But this is our personal finance roadmap, and this is something that we really recommend anyone who's just getting started on learning about their personal finances and how to grow wealth and how to invest. This is really a good roadmap for how to get started. And we go through the roadmap on 5 different steps. Step 1 is your employer match. Then step 2, we kind of talk through setting up an emergency fund. Step 3 is debt payoff, making sure that getting rid of that debt will allow you more opportunities to invest. And then step 4, looking into your Roth IRA and health savings accounts. There's huge tax advantages to investing in these types of accounts. And then also step 5, real estate, stock market, crypto, and side hustles. So these are great ways to build wealth as well. So kind of rolling through this, step 1, the employer match. So you always want to ensure that you're contributing to your employer's retirement plan. And if they do match, you want to make sure that you're contributing at least to what they're matching you, because this is free money. So for example, if your employer pledges to match 5% of your income, you want to at least allocate 5% of your income towards your retirement plan, because in a way you're going to be doubling this if your employer is going to be matching it. So check in. If you're not sure about this, definitely check in with your HR department, and they will let you know what this does. And then we have some examples down here of really what this can do to your income, the ability to contribute pre-tax money. And then moving into step 2, an emergency fund. So financial emergencies are inevitable, unfortunately. And so it's always good practice to have an emergency fund set aside. If this is new for you, this is really just a peace of mind as you go out. It can be exhausting if you are working and saving and you're building up your fund, and then your car breaks down and you have to spend $900 to it. Whereas opposed to if you have this emergency fund already built up, it would allow you to kind of keep that momentum going. So, and then always want to point out buying luxuries like a new iPhone 13, that is not an emergency. So really taking into consideration what's going on with your finances. General rule of thumb is to have 3 to 6 months of your living expenses stored in an emergency fund. So that's something that we recommend looking into at this point as well. And as you're going through this, if this is really your first time digging into your finances and you're not really sure what a lot of these terms mean, and it can be so overwhelming in the beginning. I remember I was there. I remember sitting down at my first job and they were showing me Fidelity and trying to set up my retirement account. And I had no idea what an IRA was or what a 401k was and what the percentages were and what it means. And so just be patient at this stage of the process. This is your assessment phase. So coming in with your nursing hat, assessing is always the first step. And so if this is new to you and you've never looked at even where your money is going, it can be very enlightening to come at it with an assessment mindset of like, okay, you're just going to assess what's going on with your finances, what the money looks like, where it's going, what your options are. And then from there, you're able to make interventions, right? So looking into your emergency fund, just kind of looking at your finances and what that looks like, looking at your monthly expenses. This can be an eye-opening experience for people. As well. And then step 3, pay off your debt. So unfortunately, a lot of us healthcare professionals accrue debt when we are going on to pursue our degree. It's just a part of the process. Physicians get hit hard with this, nurses as well, physical therapists. So a lot of us are dealing with debt when we come out of school and we start earning a paycheck. So a big priority is paying off this debt because generally this debt is accruing at an interest rate that is higher than you could be able to invest. And so it's always good to be aware of what the different interest rates are with your debt and whether or not it makes sense to pay it off before you start investing. One thing I do want to point out with this is not all debt is bad. And this is something that you'll learn, especially if you start learning more about real estate investing. One of the things that makes real estate investing so powerful is that you can leverage debt from a bank to go out there and buy real estate. And this is really seen in the asset class of real estate that isn't seen in any other asset classes, is the ability to go out and buy $1 million real estate property with only $250,000, because in most cases a bank will give you a $750,000 loan to go out and buy that $1 million property. You cannot do this in gold. You can't do this in stocks. Nowhere will you see someone who gives you a loan to go out and buy $100,000 worth of gold with only $25,000. So the ability to leverage debt and other real estate investments is a very smart tool. So we do not want to label all debt as bad. This is really to get more insight into what debt is doing in your life in terms of what interest rates it's currently at and how much you're paying that off, and then how big of a cloud that is on top of whether or not you're going to be able to invest. So we have a couple tools on our website, a debt snowball, debt avalanche plan. We have different spreadsheets where you can kind of check this out and see what it looks like to actually pay off debt. And this is a great checklist that we created. Start a budget, cut all expenses that don't add value to your life, find ways to increase your income, and then track your debt and budget every 2 weeks. So you want to get into the habit of this just so you can have a good idea of what's going on with your finances. It'll give you better insight to make decisions that'll give you more leverage moving forward. And then step 4, the Roth IRA and health savings account. So these are two really great investment vehicles where no taxes are owed when you withdraw. So this is great. Usually healthcare professionals especially are hit heavily by the tax burdens, and this is a great way to kind of avoid some of those taxes. So with a Roth IRA, you pay no taxes on the investment gains when you retire. And then there is a max contribution of $6,000 a year. And this does change occasionally, so make sure that you stay up to date. You do want to be giving the max contribution if possible, because this is a great way to grow wealth tax-free. And then again, kind of breaking these down a little bit further, showing the differences between the Roth IRA and a health savings account. Health savings accounts are triple tax advantaged. So this is something that we have always, with my husband and I, made sure to have in our employer plans, a health savings account, because you can go out and buy certain medications and different health supplies pretty much tax-free. And step 5, real estate, stock market, crypto, and side hustles. So this is the fun part, right? So this is the stage in your journey where actually wealth building begins. And these are different opportunities where you can really grow well and start investing. So savings accounts are, so one thing I want to talk about in this section. So when I would share this information with nurses and me investing in real estate and crypto, and I had a nurse tell me once, wow, I applaud your risk-taking ability to be able to invest in real estate. And as I started asking her a little bit deeper about what she does with her money, she says, oh, we don't invest in anything. We're savers. We've been saving our whole lives. We have, $100,000 sitting in a savings account. And as I started learning a little bit more about what she was doing with her finances, I then went on to explain that money sitting in a savings account, that is so risky, especially with what is going on with inflation and the economy right now. Money sitting in a savings account where it's accruing no interest, and with inflation, that money is actually losing. So if you have $100,000 sitting in a savings account, it's not getting any interest. It's just sitting there. It will lose money over time because of inflation. And so that is where you want to take this money and now invest it in cash flowing assets like real estate, crypto, different side hustles. And moving on, 90% of the world's millionaires invest in real estate. And so there's a lot of huge opportunities, especially in real estate investing, huge tax advantages, the ability for loan pay down, cash flow, appreciation. Real estate produces cash flow every month. So there's a lot of different opportunities in real estate, especially where you can grow wealth. And so these really start with education. So as you're moving into side hustles, cryptocurrency, even back into real estate and stock, when you start investing in these different categories, you really want to make sure that you're educating yourself and either getting that information from people that you trust, or you're getting information that you can verify with other information from different people. You always want to make sure that wherever you're getting the information is from a trusted, vetted source. Unfortunately, in the internet and even in mail and on the phone, there's so much scam going on, and you always want to be very cognizant and aware of where you're investing and educate yourself first. So you'll see nurses that are doing IV infusion clinics, concierge nursing, different nurse coaching, legal nursing, and then even in real estate. So if this is something that is interesting to you or you want to get more information, I would first suggest to reach out to people who are doing it. So if you see nurses out there who have an IV infusion clinic and you're wanting to do one, reach out to them, see if you can hop on a call and see how they got started, if you could pick their brain. If you see other nurses that are investing in real estate and that that's what you want to do, reach out to them. See if you can get any resources. Like I mentioned, we have courses, different tons of free material on our website. I'm more than happy to set up coaching calls to walk people through this as well. But the biggest takeaway that I want all of you guys to have with this is really the ability to start growing wealth now and to have multiple streams of income. And you could think, now, working at a nursing job that you have your paycheck coming in, but what were to happen if you didn't have that paycheck anymore? For me, it was on maternity leave. That was my only stream of income. Now I have real estate investments that are bringing in different streams of income. I have side hustles that are bringing in different streams of income. So I was actually able to go down part-time at my nursing job, and now I work a couple days a week, and I have my other investments that are bringing in different streams of income. And so I'm not completely reliant on my job anymore, and it allows me to go to work way more fulfilled, able to give way better care to my patients, and just be able to provide a lot more opportunities for my family. And so nurses, especially, you guys are in a great position to take your money and put it to work for you. And that is exactly what investing is taking that money that you're earning from your job and putting it to work for you in investments, and so that those are generating income for you. And so that now is bringing in passive income into your life. And so once you start learning about those different opportunities, you'll realize this is the best way to grow wealth. And so with that, I'm running out of time, but it was so great to be able to present to you guys all different ways to grow wealth and to become a little bit more knowledgeable and cognizant of your finances. Like I said, you can reach out to us on networthnurse.co, or you can find me on all social media accounts as the Net Worth Nurse or Net Worth Nurse. More than happy to connect with anyone who wants to learn more. And thank you.
Okay. Wow. That's a beautiful one.
Savannah and Royo, and before
Yeah,
we get started,
that was a beautiful one. Just going to, yeah. Thank you all. Thank you all for everyone still watching. We just continue to stream this. Before I continue, we want to present two other certificates to two amazing mentee, and I'm just going to share that here now. Just a second before we go to the next. I know we've spent a lot of time. We have one more Goodwin message, still talking about wealth building. But like I said before, then I'm just going to share this with us. Okay, I hope I have it there. Stay tuned. So as part of what we do in the Norse Mentorship Academy, just to keep you abreast as well. So we do, like last year, we do have a mentee that was awarded extraordinary. So, out of all the mentees that we have, there will definitely be one that was outstanding, most outstanding. All of them were amazing. But of course, we did have, one that stood out. We will see who that person is today, and we're going to celebrate that mentee. So we always give that as that award of extraordinary Gist Star. So like every mentees in the Norse Mentorship Academy, we have that way of calling ourselves. We are Gist Star. We are guidance from the word Gist Star. So we do have the extraordinary Gist Star. Do you want to guess? If you can maybe just drop in a comment there and guess who this person is. Who is the extraordinary Gist Star? Apart from these, we also have a category. This is a special one that is actually coming out today. So the extraordinary Gist Star is no other person. The award will be sent. I'm trying to locate it here. The extraordinary Gist Star. Wait, let me look for it. I must not miss this. The extraordinary Gist Star for the Cohort 2 of the Norse Mentorship Academy is no other person than Akpan Akawo. Akpan Akawo is the extraordinary Gist Star. You know why he qualified for these? There are mentees and there are mentees, but we have mentees that go extra mile, make themselves available, volunteered in so many things, and do even more than you ask for, always available, always reaching out. So it's not just about giving out, but you see mentees that you can see the passion. They are always there and exemplifying what they have been taught or what they have been guided on. So Akpan Akawo happened to be that mentee, and I'm so excited today to actually give him this recognition. Thank you so much, Akpan. Your certificate, your extra, so you have 2 certificates now. Your extra certificate will be sent to you. Thank you so much. Let's appreciate Akpan there. He was the cohort rep as well, and he also volunteered to be the Norse Mentorship Academy, one of our social media managers. So he's doing a lot. So this is just our way of saying thank you for everything that you do. And another category that we are introducing today, we haven't done this before. Yeah, we haven't done this before, but we are introducing this today, and we hope to actually continue to do this. I'm going to share my slide there. Is what we call the special recognition. So this special recognition award is we have 2 mentees, of the Norse Mentorship Academy that we want to specially recognize. And, we've talked about, so many of them have shared their story, but particularly, we are giving this, I am giving this personally, to this. Okay, I'm just going to share this. You see the name, and I'll tell you why they actually earned this. So special recognition award is awarded to Muhammad Sori. Muhammad Sori, thank you for volunteering as an exemplary leadership skill at Respo Health Africa. So, that's one of the things. Muhammad was one of the cohorts 1 mentees, and after then he has worked tirelessly with all zeal, volunteering at the Respo Health Africa projects under the NCO Healthcare Consulting. So thank you so much. We appreciate all your work. Thank you he has actually mobilized and even encouraged other Sierra Leoneans, to join their academy. We hope that we'll have more fruitful collaboration and, more rewarding work to do. Thank you so much. And the other second category, we have the second person we are recognizing again is Oluwapelumi Emmanuel, a special recognition award. This is awarded to Oluwapelumi Emmanuel for your volunteering and exemplary leadership skill at Respo Health Africa. Thank you so much for taking the lead. Thank you for all those extra things that you do even when it's not convenient. Thank you for coordinating a number of over 200 volunteers at the Respo Health, and you're doing this so graciously. Thank you, Oluwapelumi. This is just a little way of saying thank you for making yourself available and for all you do for all to all our vulnerable elderly right in Nigeria. Thank you. All right, so that's about that. Thank you so much. Going to take the last Goodwill message, and this Goodwill message is coming from Nigeria again. So we're talking about wealth creation. We're talking about wealth building. So we really need to do this. Not just enough to be mentees. It's not just enough to go through all of these, and yet you are not getting anything in return. So it's good that we analysis. So I'm going to be inviting for a Goodwill message Tokwe Mark Odije. And for those, Tokwe Mark Odije is a TV host and real estate developer in Nigeria. She's the CEO of Rep 360. She's a growth coach as well, an investment coach. Personally, I say she is my real estate boss. So thank you so much, Tokwe Mark Odije, for honoring our invitation. And so we will take the Goodwill message now.
Congratulations on your graduation from the Mentorship Academy. I am Tokwe Markodige, the CEO of Rep 360, a real estate development company, and I'm also a growth and investment coach. So I want to encourage you concerning investment. Your mentor has told me to give you a charge, and I've been thinking, how can I encourage nurses to think investment? Well, the truth is, as a nurse, you have invested many years in helping you to be an amazing caregiver to those who entrust their time and their life with you. So you already understand what investment is. Maybe you just don't understand investment from the perspective of making your money to work for you. So what are the key areas you should be investing? Every human being must keep on investing in themselves. So thumbs up to you because you've already done that by enrolling as a nurse in a nursing mentorship academy. That means you value development, you value knowledge, and you're already on track. But another thing that we do is we don't implement many of the things that we learn. So after you go on this journey consistently of keeping improving yourself, investing in yourself, you must be deliberate about implementing every idea that you get. Maybe through your mentor, because we have access to mentorship and we don't use them. So use your mentor very well. It is to your advantage. It is part of your investment. But I know what your mentor wants me to teach you. It's about how to invest your money and make your money work for you. So let's go into that. When you earn, every human being that earns must pay their future self when they stop earning. That's simply what investment is. It's a process where you take from what you are earning while you are working to ensure that your future self can take a break without working and still have money coming for them. So you must grow deliberately, that every month you are taking out money to invest in one business or the other. That's the first kind of investment. Savings is the lowest form, but it is the most important form. Every human being who wants to invest in big things must start by saving small. Every month you're saving. Because before you can take advantage of investment opportunities, you need to have a little money. Like you've saved up a few change that has accumulated that you can then use to take advantage when the big opportunities come. So start by saving intentionally. Don't touch your savings. It's not your emergency fund. This is an investment savings. What it means is this savings is locked down. Whether heaven falls, I don't touch it. This is my future. If I don't save this thing, I will be hustling all my life, and I don't want that for you. So you must be intentional about creating that savings. Then what you do next is to start looking for opportunities for future investment. I advocate real estate. I am passionate about real estate. I feel that nothing pays you as much as real estate when it comes to investment that is safe. It is after you have done the safe investment, you can start doing the volatile ones because you have extra change. But your first set of savings should go into a real estate investment. Lock down that land. Lock down that land. Lock down that land. I said it 3 times deliberately because I want you to retain it in your mind. Lock down the land. Lock down the house. What you do when you do real estate investment is you tie your money into one thing that will continue to appreciate. Of course, there is stocks and you have the bonds, but I would say first investment you should do is a real estate investment into an asset, not the one where you give your money to them and they'll be paying you returns. No, have the asset in your name. What that does for you is subconsciously it triggers your mind to enter a place of abundance because you know you have a land somewhere, you know you have an investment somewhere. It also gives you a little bit of peace so that you're not constantly in survival mode in your head. It triggers abundance, and so it's essential that you start your investment journey by owning a property. If you already own one land, then you can start moving towards, okay, maybe I want to buy a house or I want to build on the land, but start with owning a land. Now, there are many ways you can use your land. You can farm on your land. You can have someone farm on the land for you. You can build on your land. You can rent out your land. But essentially, buying the land is one step on your journey towards investment. There are many other investment opportunities. I will still stay within my real estate space. The next thing I'll tell you to do is consider agricultural investment opportunities. That is, buy a farmland and partner with agric-based companies to help you to farm it, whether in Nigeria or abroad. You can do this. There are opportunities for you to partner with agric-based because you can use small money to get a lot of mileage. Let me move on quickly to buying shares. I know that I rarely talk about buying shares, but I will tell you, do it. Buy shares, but buy shares in what we call everlasting companies, Fortune 500. Buy shares in companies like Coca-Cola. Buy shares in companies that have lived over 100 years. The reason you buy these shares is because no matter how big you think the money is now, they have a track record of consistently growing and they will continue to grow. Now, they are not easy to liquidate, but they'll pay you dividends every year. So it's a very good way to also put in your secondary funds. So your primary savings go into real estate. Secondary savings, you can go into shares. Then when you are in abundance, those excess money that you did not plan for that comes into your pocket, you can use it to do those volatile ones. Okay, today is Forex, tomorrow is Bitcoin, is crypto, whatever it is you can then use for those risky investments. I want to share about another thing when it comes to nurses. Many nurses and many professionals see income as only from their professional work. So I'm a doctor, I work as a doctor and I earn salary. I'm a nurse, I earn salary as a nurse. But I want you to start thinking in terms of investing from the perspective of being an entrepreneurial nurse. What that means is you are not sweating to earn, but you are using your brain, using your resources as a nurse to create a business around nursing. You are not just going to be a nurse forever. You must have a plan on how, after you stop, you get tired of nursing, how else can you make money from the skill you have as a nurse? Are you nursing online? Are you offering telemedicine? Are you offering consultation as a nurse people online? Are you educating people online with your knowledge as a way to raise more funds into your pockets? Because at the end of the day, there are multiple ways you can use the skills that you have to earn money, and it is important to maximize all those. So I'm a nurse, I work taking care of patients. 2, I advise patients off when I'm not working. 3, I generate courses on nursing online to make money. 4, I generate content on social media as a nurse to also make money. I have listed 4 opportunities. Sit down and list many more. I know that I cannot in 10 minutes or 5 minutes share all that you need to know concerning investment. So it's important you read books on investment, buy books. Rich Dad Poor Dad is one book I recommend everybody should read if they are thinking of investment. Also, I'll tell you to also buy a book called, it's not really available for sale like that, but it's available online. The Richest Man in Babylon is a very good book I advise you read. The more you read on something, the more knowledge you acquire in that field. So Make it an intentional thing that every month you're reading something, listening to a podcast, listening to someone who is financially successful, and by acquiring knowledge from them and implementing those knowledge, don't forget implementation, you are growing your trajectory towards wealth. Thank you for this time. Thank you all once again for listening to this video, and congratulations once again to every one of you. Now let's go make the money, keep growing.
Wow. Wow. Brilliant. So thank you so much. Somebody said I've been waiting for. Yeah. So we have finally come to the end of, we've come to the end of the graduation and presentation and everything. It's been so overwhelming, but I'm so happy that we got to this stage. Honestly, thank you so much for waiting. Thank you for staying true. And to all mentees as well, I know some of you have gone, taken excuse. You're watching this. I'm so proud of you. I am so proud of you. And, this is just to encourage every other person. If you want to enroll at Norse Mentorship Academy, the door is open. So the enrollment for the next cohort, not really a cohort because it's going to be, up and rolling, not a cohorting again. So you have all the, the platform to enroll. You can go to our website now or use the link that has been posted to join the early bird waiting list. Early bird to enroll and enjoy the benefits. 50% discount if you enroll between now 48 hours. So the which start from today. So early bird closes in 48 hours. As soon as we launch into August, the price is going to change. So register. If you know anyone, nurse, doctor, any healthcare professional, or aspiring, maybe you're even thinking of going into the profession, or you've just recently gotten an admission or something, please make yourself, you just add to yourself, this is an investment. It's not just about money. So the academy is also a place of investment for you. And so the other announcement I'm going to make, again, like I said, all the graduating mentee, you have opportunity automatically joining the NMA Legacy network, where you act as, mentor, support, and, support system for incoming mentees as well. So congratulations for that. Respo Health Africa is an initiative of the NCO Healthcare, and what we focus on is in promoting responsive healthcare for the elderly in Africa. So at the moment we are having a pilot project, total care package, and we have so many volunteers, and we've undergone the two phases of the project, care need assessment, and we are heading into the care intervention. So if you want to volunteer to be part of this, to support the elderly, vulnerable elderly, please, you can join as well. The book Emerge. Yeah, the book Emerge is on the way. I want to use this opportunity to, really apologize and also thank everyone that has pre-ordered the book Emerge. I know that you've been waiting for so long and you can't even wait. You can't wait to get it. I can't even wait myself. There's so much work that has gone into the work, so much more that has even gone in even after the announcements and after so just to make sure that we bring out the best for you. There's no we have so much that we want to give it. So please, originally was supposed to be launched today, but of course some technical issues as well, publisher hiccups, and we are dealing with that. Hopefully in coming weeks we will get all ready. So the book Emerge is still coming, and of course we have this new set of mentees that just graduated, and they are launching Imagine to become high performance healthcare professional. So do you want to be an high performance healthcare professional? Do you want to, have a rewarding health career? You want to be fulfilled and satisfied? Sometimes it could be very overwhelming, frustrating, and a whole lot with the healthcare system. But do you want to have that radiant joy, even doing what you love to do? Join the Norse Mentorship Academy. So, catch here. My name is Olayinka Aremu. I remain your humble Norse coach Ola, or Norse mentor, as you want to call. You're welcome as well. If you want to become a mentor officially, you want to get trained, you want to have that, that knowledge of becoming a mentor, what it takes to be a mentor, you can also, we have a separate module for that as well. If you want to sponsor any of the mentee, we have opportunity. Please, you can sponsor any mentee, because there are some people that actually want to be mentored, but they don't have the financial, capabilities. So if you want to sponsor, that will be another way of supporting the Norse Mentorship Academy. Please, the link is available as well for you to sponsor. We will really appreciate. So thank you very much. Again, I want to congratulate all the graduating mentees at the Norse Mentorship Academy. Be proud of yourself. I am proud of you, and the world is waiting for your manifestation. Thank you very much. Have a lovely evening, and let the celebration begin. Bye for now.